Excuse me. Hello, 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 you guys. So you'll just see me for a second. I want to let you guys know that I have another clinician that is going to co-host this show with me. So let me go ahead and get started. We're going to talk a little bit about what it looks like for you to get help by seeing a therapist for clinical issues. So see you in a moment. Hello, hello, hello. Welcome to Life Discussions with Dr. Jefferson. I am your host, and I have a special featured guest today, that LCSW Dominique, which is she's also the host of All Things Mental podcast. So if you guys are not already subscribed to her channel on YouTube, you definitely got to go and do that. But also, she can be heard anywhere you're listening to podcasts. Just ask them to play the podcast All Things Mental. I think that she has a very interesting podcast. I think you guys have seen her before because she is a clinician, but she's talking about on her podcast the way the characters on screen in different shows can be relatable to the way that we see ourselves and the way that we see symptom presentation um, in people that are struggling with the various mental disorders as a result of brain issues. So, hey, Big Kane, how are you? Also, shout out to the chat. How are you guys doing? Go ahead, Dominique, and introduce yourself to the viewers so they can know where to find you.
Okay, thank you for kind of introducing me. My name is Dominique Jackson Pittman. I am a licensed clinical social worker in the state of Indiana, and I am the founder of Inspired Peace Counseling Services. We provide individual, um, family therapy, individual family groups to a whole host of individuals. So people struggling with anxiety, depression, gender identity issues, marital issues, things like that. So just look us up. That is at IPCS Indiana on Facebook, Instagram, and Twitter. And you can also find my podcast anywhere you stream. And that's All Things Mental, like Dr. J said.
Yes. So we're gonna get into this. I posted in the description some basic questions, and Dominique, you have them on the private chat screen. So that way you guys can kind of see us kind of reel down, kind of go down the list of things we're going to talk about today. But the very centralized focus of this conversation today is going to be accountability around people who are in the mental health field, but also for you guys, to give you guys accurate information, reliable information, and facts about what it looks like to align yourself with someone that is clinically practicing in this field, in a manner that can help to alleviate some of your presentations of your symptoms, your distress, whatever it is that you're going through, even when it comes to grief, whether it's complicated or not. Help you move through the different phasal development stages of life as well. So, you guys can definitely ask us whatever questions you have on your heart, on your mind, about what it looks like for us to be competent in this field and deliver the therapy to you. You can ask us questions about how trauma manifests and what that looks like, what it looks like for you to recognize what trauma is. You can ask us what trauma is in general if you want. So, we are going to jump right in. And also, as you come in, don't be a stranger or weird out there. Just go ahead and say hello. So we can shout you out and give you your due diligence and recognition for you tuning in today and elevating yourself to another level of understanding about yet another topic here. So, my first question for you guys watching is, have you ever seen a mental health practitioner before? So, somebody who is a mental health practitioner could be a life coach, could be a wellness, or could also be a fitness coach, because they are there to also balance the components of your brain health and your mental health. There are also mental health counselors, licensed professional counselors, licensed clinical social workers. There are, of course, us, the greatest marriage and family therapists, because we're systemic. Integrative practitioners, which is another level of neuroscience based practitioners, typically with a background in the medical field. That's more specific to what I do. Psychiatric professionals, psychologists, because we have some psychologists who are counseling psychologists, so they're clinical psychologists or whatever. There are a host of people that you could be seeing to help you stage and acquire the skills that you need in order for you to manage your mental health and wellness. So, also you got marriage counselors, couples counselors. They're also one of the many things that I mentioned before. So, I want to know who has actually seen a practitioner before, if you guys are comfortable with sharing that information. If you have and you're comfortable sharing the information, type a Y in the chat. And if you are a person who feels like at some point in your life you have underwent some level of clinical distress, but you didn't see someone who was in a mental health field, then go ahead and type a in the chat. Okay. So I will disclose I have had a therapist for a large part of my life. Um, and it's always been like kind of like an on and off kind of thing, but it's always been very helpful for me, in the latter part of me having one, to deal with post traumatic stress disorder and things like that when I came off of different tours of duty in the military. And being in that type of environment in general can sometimes be extremely highly volatile and stressful for people. There are issues with women, being a woman in the workforce, that I struggled with during that time, considering the fact that I was in the military, and the military was a place that wasn't very welcoming to women, especially as leaders. Um, but also being a very high ranking official, and then the more decorated, the more issues. So I think there are a host of reasons that you can see a clinician. I've had people come in for all types of different issues, all types of different issues. And also, I'm a sex therapist, so people come to me for those complexities around their trauma and relating to intimacy, becoming more intimate, and finding the different parts of themselves, and limiting some of that inhibition, removing some of that, so they can be more closer connected to the people that they are in relationships with. So, what about you, Dominique? Do you want to share?
Okay, so um, at a different point in my life, you're actually mandated to have a therapist when you grow up in the system. So you kind of, I mean, these people are mandated. So it's not as if, meaning it's not something that you want or it's not something you understand. So as an adult, I wouldn't necessarily say that I have one. I have a lot of friends that are clinicians. Now, I wouldn't recommend this because it could be unethical. So I'm not speaking of anything unethical, but I do have friends who are clinicians, and we go out and we talk, and we're a support group or support network for each other, where we're holding each other accountable and talking about different things that might be a struggle. Um, so a network of people, yes, but as a kid it's like you don't really understand everything. That's like, you just like, why are you in my business? I'm not trying to do this. And it's a stigma in the Black community. Like, I don't know why I'm seeing you. I ain't trying to talk to you. I'm not supposed to be telling you all this. So it wasn't something that was like,
You desired, but it was more like a forced component.
right.
What about you guys in the audience? Have you ever, any of you ever experienced therapy? Have you ever been in therapy? Have you been in therapy individually or collectively? I hear Money Boy Trey in the audience trolling already.
Well,
Oh
how do
no.
you know? You
I don't
know, what's the need? Why do you feel like you need a sex therapist?
Yeah, yeah. Tell me what you feel like you need a sex therapist for. Keep it PG for my brain. I'm having a Simone Biles movement, okay? Moment, right? I just know what my limits are today. It's been a stressful day. But no, seriously, how do you think God, this guy.
In
How do
order
you
to
think
help,
you
you need
identify
to know why.
exactly? How do you think you identify what type of therapy you need? Like what do you think the process looks like? Have you ever had a therapist before at all? Also, you guys, I didn't mention addictive disease, addiction treatment professionals and stuff like that, but they are great too. Okay. I like to have a lot of sex. That might be something that is clinically
Yeah.
significant.
Why do you think it's a problem?
Hmm. I think Dominique raised a really good question. So, why do you think it's a problem for you? What do you consider normal? The normal amount of sex for a person? And then the other component is, are you in a relationship or are you single? So, do you think that based off of your relationship status, you need the help, or is it something else? How do you know when one needs sex therapy or the professional? You're so smart.
It can be subjective.
Yeah, it can. And I tell people all the time, you have to weigh in on what it is that you're doing and the effects of what you're doing on you being productive in the different domains of life. So when we talk about things that are clinically significant for therapy of any kind, whether it's sex therapy, intensive traumatic therapy, or any type of particular intervention, what it's based off of is whether or not this thing that you find yourself doing prevents you from operating at your norm criteria behavior in all of those different functional domains that you're responsible for being present in. So people are collections of self. So separate components of self are within you. So when those different components of self start to misalign themselves and your behaviors don't align with what your outcomes should be, that's when you can definitely say, hey, there may be something going on here. I might need some help. Um, and when we talk about porn addiction as well, porn addiction, so viewing porn is quite normative. However, when you start noticing that it prevents you from going to work on time, whether you're getting written up or not, it has been something that landed you in jail because of the nature of the pornography that you are enjoying, but you continue to indulge. You see where I'm going? When you notice that these things prevent you from having success in those different domains where you're meant to be present in the way that you're expected to be present in those different domains, that's when you kind of have to explore whether or not it's clinically debilitating. So what about you, Dominique? What do you think?
I'm reading this real quick. What do I think specifically about?
What do you think about his assessment of the fact that the expert in the of the process, because essentially clinicians are the experts of process. We're not the experts of your story. We're only the experts of the process of healing. So we have specialties in um, listening, clinically reflecting, helping you and guiding you through traumatic experiences so that you can get to a more viable means of, behaving and regulating, self-actualizing, relating to other people, interpersonal connections, and things like that. Those are the things that we typically specialize in that help you to alleviate the surface symptoms, because we're helping you safely explore what's underneath the surface so that therapy or healing can take place and you can return to a better, more evolved and matured individual.
Okay. Let's see. I think that we have the capacity to have like a type of discernment. Do I feel like have I ever asked myself, is this a problem? Like when we think about depression, do I do I feel like I'm sleeping too much? Do I feel like I'm super sad? That's why I said that it was subjective. Like, do you feel like you have a problem? If somebody else feels like you have a problem, they can talk to you all day about it, and they can tell you their concerns. But if you don't want to do anything about it, then you're not going to talk to anybody about it. So you have to come to terms with, okay, do I have a problem? Even if you think slightly this
There may be
could be a
some
problem,
validity,
then
right?
talk to somebody about it. And then you process through, okay, well, I do watch a lot of porn. Well, what's a lot of porn? Can you not get through the day without watching porn? Can you not get through the day without masturbation? Can you not get through the day without thinking about um, sex? So that's why I say it's subjective.
Right. And it also depends on what you do for a living. It depends on what your lifestyle looks like. So for example, um, we would look at rating whether or not sex addiction or porn addiction were a thing in a different way if we had a person who struggled with substance abuse issues. So substance use culture looks a certain way. It doesn't look like criteria culture. So if you have a history of using substances, the behaviors that go along with normative or accepted practices look a lot different than they do in pop culture in Western society. So you know, it's all in the context of your functionality, like I said, in those domains. So if you find yourself getting written up at work because every time your supervisor walks past your desk you're in your phone looking, looking at booties and sex acts and things like that, and you're not being productive at work, and you've been written up and you're still going back to those same behaviors, then I think that you do have to do some deep seated exploration. You have to ask yourself, like, what's keeping me in this cycle of behavior? You have to ask yourself, is this congruent with what my outcomes are, my expected outcomes are, and things like that. What's going on, official urban therapist? How are you? And Miss Sandy, you had a really good question. You said, do you have to be an expert to diagnose someone? The answer, in short, is yes. But even more specifically, there are certain experts in this field that don't even hold the right to diagnose, depending on from state to state what the regulatory authorities are, because it's so different from state to state, which is a larger issue in the United States, but it's only an issue that the United States has. But as a person who is registered internationally, and I have been doing this for quite some time, and I'm also a MD. Um, what I notice is that there are a lot of people, even the people who are qualified technically to diagnose, or what we call CDX or confirmed diagnosis. I don't want to say it. The producer's not here, unfortunately, but um, some of those people are not even adequately equipped to confirm diagnosis. It's a thing. It is what it is. But that's sort of what we're here for today, accountability conversations anyway. So, um and this is a little bit of a difficult one for me for a couple of reasons, you guys, because I feel like I am a clinician that understands that in order for people to be really and truly competent in this field, they have to grow into competency. So your tenure in the field, supervised adequate oversight of you seeing people or gaining experience in this field is what creates a sense of competency. I run a competency school for other clinicians, and sometimes that's difficult. He'll be back soon. He just went to grab me a sandwich. But sometimes it's difficult even after clinicians go to school for a very long time and they acquire thousands of hours of clinical direct face-to-face contact with clients. Sometimes they're still not yet ready to really get out there and really fully understand and comprehend what a diagnosis entails. And I will definitely expand on why that is. So for every diagnostic condition that because based on the criteria, right, met, there are 240,000 or so other diagnoses or diagnostic indicators that qualify for those same set symptoms, right? Because every diagnosis has specifiers, and things like that. So that's a lot of technical and clinical lingo that I know you guys don't understand because you're lay people for the most part. But I know I have a couple of followers who are clinicians, and I know y'all know what I'm talking about. So doing this work requires tenure and full on understanding, not just the subjective understanding, but also innate truths and objective understanding of the diagnostic components.
I think that's interesting. The comment by Miss Andy.
So all these women claiming they divorced their husbands because they are narcissists or crazy with no expert diagnosis are blatantly lying.
So there's a lot of, so someone can say I'm depressed and not be diagnosed, and not say, they diagnose themselves with depression, or somebody else that's not competent in the field has diagnosed with them. I'm
Don't look
looking
at that.
with depression. So, or somebody can say I have anxiety, but it doesn't mean that they're diagnosed with anxiety. It's just anxious symptoms. So narcissism is, I mean, it's like you can look in the dictionary and there's a definition for it. So they
Mm,
can say, this person is narcissistic, but they are not necessarily diagnosing them. Um,
They're just speaking to the behaviors. So every personality disorder, for every disorder in the diagnostic manual, period, we have diagnostic conditions in order to attribute a confirmed diagnosis. So that's what I was talking about earlier. Um, we have to look at differential diagnosing. We have to do a comprehensive history taking. We have to look at cultural factors. We have to look at societal factors. There are a tremendous component of information taken that goes along with the process of diagnosing a disorder. However, narcissist is a word that's oftentimes overused by society. I will say that because the every personality characteristic that people have, there are inflexibilities that make those inflexibilities congruent with a diagnostic condition. Does that make sense? So a person can be narcissistic in presentation and still not have a confirmed diagnosis of narcissistic personality disorder per se. Because various people, many people in society encompass at least three diagnostic criteria that feed into narcissistic personality disorder at any given time. So the thing that doesn't make it a personality disorder is the fact that it's not a consistent and pervasive pattern of behavior, for whatever age that diagnostic condition has to have in order for it to be met. Does that make sense? So they could definitely see that they have a person that's overbearing, that is narcissistic in their presentation, but they're not necessarily saying that that person has narcissistic personality disorder. Because I'm going to say this too. People are not diagnoses. People are people struggling with the various components of mental health disorders. So you're a
yeah,
person dealing with narcissistic personality disorder if that's a disorder that you have. And there are a lot of people dealing with it.
and I think that's I mean, you hit that on the head. Like, there's a difference in he's narcissistic versus he has narcissistic personality disorder. So I hope that what you said also answered Miss Andy's question, because I mean, we all display different things, but a narcissistic person, they're probably not necessarily going to go and get diagnosed or go to any type of therapy because they don't feel like they're doing anything wrong, or they don't feel like anything is wrong. So it's just I am this versus I have this,
Yeah, this
or
condition.
he is this versus he has this. So I don't think that they're necessarily diagnosing a person. I just think they're saying this is the
Just like
criteria, this is what they are displaying.
just like I'm depressed, right? I could say I'm depressed, but I don't have a depressive disorder. I don't have major depressive disorder. I'm not diagnosed with dysthymia. I'm not diagnosed with cyclothymia. I'm not diagnosed with any conditions of depression whatsoever. Okay. No dysregulation disorders. These are the different types of depressive disorders. However, I can be depressed, the mood state of depressed, without having to be a person who has persistent depressive disorder or um, moderate depressive disorder or anything like that. So, it is what it is. I feel like we have to be 100% congruent with having an understanding of the difference between the features and the diagnosis. So anybody could recognize that a person has clinical symptoms that are definitely in alignment with the diagnosis. However, a confirmed diagnosis means that you have to go to a clinical with a diagnostic clinical specialty, or a medical doctor, or a medical doctor who practices psychiatry, or a psychologist.
I think that's where the support comes in too. Like, hey, you might say, hey, I think you're dealing with somebody who is like who displays these things, maybe you should talk to someone. I don't think people's friends or someone who is not trained in diagnosing should say, hey, yeah, he has narcissistic personality disorder. Even if there's somebody who's telling you this person has all these things, they still shouldn't be diagnosing that person until they actually meet with that person. So supports come in because, hey, you're sleeping a lot. You seem like you're depressed. Maybe you should talk to somebody. Hey, you're not eating. You're not um, doing the things that you normally like to do. I think you should talk to somebody. So they can say, hey, you're depressed. Um, but they can't say, yeah, you're diagnosed. You should be diagnosed with depressive disorder or a depressive disorder.
Or bipolar disorder, because that's one that's oftentimes thrown around. And most people who come to me and they're like, well, you know what, Dr. Jefferson, like somebody told me that I had bipolar disorder, that I'm bipolar, and blah blah blah. um and Miss Sandy, to answer your first question, we are describing moods because they are mood states versus the diagnoses themselves that people can contribute to their understanding of. So a person can talk about a person being narcissistic. Being narcissistic is not a disorder, it's a state of being. So more it is descriptive of a mood, and behaviors in congruence, I guess, with the way that that person relates to them or doesn't really relate to them. um Maybe they aren't in the mood to eat. Why does it have to be disorder? So like we said before, and to answer your second question first, mood disorders are mental disorders. We do have mood incongruent disorders, and you can definitely be diagnosed with a mood disorder, and they do have to be clinically significant. So that's why it becomes a disorder versus a just a behavior or a mood. Does that make sense? A mood state or state of being. Like I said, if I were to say I'm depressed, I can say I'm depressed, but it doesn't mean that I have a depressive disorder. And there are many of them. And you don't just meet the criteria for all of them just because you have a depressive disorder. You have to have a specific one that you meet the conditions of. If you meet one, there is no way you can meet the other one. Does that make sense?
And it has to be a certain amount of time. So you're right. Some people might not just be in the mood to eat or may not be in the mood to hang out with people, but the clinical significance plays a part because how is it affecting your daily functioning?
Exactly. So so let me be very specific. In order for any mental diagnosis, in order for any mental health disorder to be present, we look at the presentation of symptoms, the frequency, the onset, duration, intensity, and whether or not it's a pervasive pattern of behavior. So, if you get a raise at your job and you get happy for the day, that wouldn't be congruent with a mood disorder because it wouldn't meet the criteria for a pervasive pattern of behavior. So, pervasive means over a long period of time. And the shortest amount of time that um, is that a person can meet a diagnostic condition for is 30 days, right? The vast majority of the short lengths of time is about 6 months. But for the vast majority of mental health disorders, it's 2 years. Some of them are a year, but the vast majority is going to be 2 years of a pervasive pattern of blah, 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 as evidenced by particular behaviors. So, these are things that we look at. And like I said, most of the time, if you're not looking at all of those different things and you're not looking at how those different things are clinically significant by way of interfering with the regular functioning of the person in the different domains that they're responsible for showing up for and being present for, like at work, at home, with friends, environment in general, leisure, blah, blah, blah. If you're not looking at these components, then there is no way that you can attribute an accurate diagnosis. You would have to be able to see how that person functions and do some history taking from other people around them. It's a pretty comprehensive process. Let's just say that. It takes a lot, which is why we discourage people from self-diagnosing and using the internet to look at a bunch of symptoms and say, oh, well, yeah, I saw this on the internet and it was a reliable source. Because remember, you told me, Dr. J, like NAMI is reliable. Like, absolutely not. Death of the internet. Do not, you know what? Break your phone, throw it away, throw the computer too, throw all of it in the trash. None of it's reliable. Because the reality is, you don't want to self diagnose and don't want to find yourself going down that rabbit hole and trying to find your own diagnosis, because you're just not. It would take years for me to be able to train you guys to understand the intensity and the depth of diagnosing. Let's put it like that. So if your spouse is constantly nagging you to death and you display narcissistic behavior, then it could be just a mood, correct? Yes, because narcissistic behavior are patterns of behavior, not necessarily the persistence. There is no evaluation for how that person is, those symptoms are congruent in other domains, how they interact with those people, for how long it's been there. In narcissistic personality disorder, let me be very clear about that. It oftentimes people only look at the grandiosity of it and they're like, oh man, those people are very much together. They're very attractive. They're very outgoing, blah, blah, blah. Underneath all of that facade are deep seated insecurities due to various attachment traumas. So, that for a clinician, right, it's a different way that we see pathology and diagnosing than what you're looking at, because you guys are only, you're not clinicians, you're lay people. So you only look at the surface behaviors. We look at underlying motivation, emotions, feelings, thoughts, reflections, experiences, perceptions that motivate the attribution to said diagnosis. Right, Joe. Hi, Joe, husband. Joe is Dominique's husband, you guys. That's so cute.
And he's right. Everyone's normal is not normal. I
Hmm.
always say that. Good looking out.
Look at that. You're teaching Joe something. Look, look. Okay, Joe. Okay. That
Working on that.
LTSW. Shout out to the Pittman house. But no, like literally, you have to understand that it's it's a very difficult thing for people to understand the complexities of diagnosis, because it's even difficult for the people who present as clinicians, okay? And when I have a lot of people come into my academy, my program for training, they could have been clinicians for a long time, but diagnosing is something that they got very far away from, either because of the stigmas associated with it and they felt like it could get them better outcomes with their consumers if they kind of placated, or it could be a combination of things, just trying to make people feel more comfortable. But people need to know what it is they're dealing with if they are to alleviate the symptoms and the presentation of those said disorders and move to a healthier level of functioning in the various domains that they're responsible for being very much emotionally and physically present. Because here's the thing, there are a lot of mental health disorders that manifest physical symptoms and can affect your overall physical health, biological health as well, because it's all together. Um, he said, then all these women that are saying their exes were narcissists is blatantly lying, especially when most of them say they were never like that when they first started dating them. Well, typically, um, if they're saying that they're narcissists, it could be very much correct, because the narcissistic component person is known for love bombing. They come off as very charming initially. What are your thoughts, Dominique? Oh, you're muted.
It's the blatant lying part. Like, I think that a lot of people don't most people don't have ill intent as far as the blatant lying part, I feel like they have their feeling about, okay, I'm trying to figure out what's going on, because a lot of people in relationships where they feel like, we'll say feel like they're with someone who is narcissistic, those are really, this is how I feel when you do this. It's not necessarily like blatantly lying. This is just their feeling about the situation in general. So I think that they have to understand what we're talking about today, that accountability piece. Like, you cannot just diagnose someone with narcissistic personality disorder. But the word narcissism is just, you can say this person is just narcissistic without saying they have this personality disorder. They're
Yeah,
just
it could be an adjective
narcissistic.
that's descriptive of a person. It could be a mood, a state of being.
But I'm interested to know, like, I mean, this is live though. I'm interested to know the situation, because it sounds like it's something that is kind of significant for you, Miss Andy. Like, this person is blatantly lying. Some people can certainly have ill intent, especially when people say, "Well, you're just antisocial," or "You're just bipolar." Um, so I think it could be subjective depending on it.
And a lot of people who say that, people are bipolar, those people aren't. Their mood is definitely incongruent. But sometimes most times, bipolar disorder, people don't understand personality disorders. They don't understand that bipolar disorder is not one of them. It's actually on a continuum between depressive and psychotic disorders. So when I think what happens is, as lay people, that ignorance is something that is perpetuated by the social acceptance of people giving out inaccurate labels or descriptions based on how those people interact with them. So I think that we have to stress beyond everything else the importance of you truly having a full on understanding of the fact that, okay, to this extent, right? I understand this person's experience with this person could have, made them feel like they were being love bombed and then gaslit. Because these are things that people go through when they're in a relationship with a person who is toxic. But it's also congruent with things that people go through when they're in a relationship with a person that's narcissistic in presentation. And also, these are things they go through with people who have narcissistic personality disorder at the very beginning, if they're at the very beginning of their clinical intervention. One of the things, I specialize in treating people with personality disorders, and I have lots of folks that I treat that are dealing with narcissistic personality disorder. However, they typically don't go out here intentionally love bombing people, intentionally gaslight. That's not an intent. That's why it's a disorder. So you do these things very much unintentionally, and they affect people in a certain way. And by it affecting people in a certain way, you typically respond in a way that shows that you have zero affect. And if you don't have any, effective responses for them in those particular situations, the number one indicator for folks that are narcissistic personality disorder congruent is that these people have zero empathy. They're not empathetic because they're incapable of being empathetic because of their past traumas in their life. So even though it's overdiagnosed most times, you know, it is what it is.
I think that it speaks to accountability. Like, you should not diagnose someone if you are not a professional.
Exactly.
Um, because diagnoses stick. There are specific diagnoses where you can't necessarily get into the military. It affects your jobs in the future. So that's why it could be very dangerous to diagnose someone with something that you know nothing about. So you can tell somebody, I mean, you're bipolar, it's not going to hold any weight. You can tell
Right.
somebody they have narcissistic personality disorder, not going to hold any weight. So people shouldn't go around saying, well, you have this or that. And if you hear someone saying that, that's the accountability piece too, because no real professional is going to go out saying, well, so and so has bipolar disorder, so and so has narcissistic personality disorder.
Mhm.
Um, Take down that license number ASAP.
Exactly.
Couldn't happen.
Right. But so, are you still confused as to what a mood is versus a mental disorder? Is that what you're saying, Miss Sandy? You said if my mood can affect someone else's mood, then how can a non-professional diagnose someone?
I jumped ahead. That's what I was answering.
Oh, um, but everything that you do, your actions affect someone else's mood more so than your mood affecting them. So one could say your behaviors are the thing that's affecting them in their response. But to to kind of, I guess, clear it up as much as possible without all of the extra words, right? Um, because it's difficult to explain to people without, you're talking about the summation of 10 years of education. That's what it takes to be a clinician. So we can't explain in a couple of minute conversation what the intricacies are of a diagnosis component, but we can explain to you the baseline components that suffice a diagnosis being assigned to people. So there is definitely a difference in a person's state of being or their mood and them being diagnosed with a condition. So it's very, I guess the easiest way to say it is this. Somebody could say, I'm panicking, right? Panic disorder is a disorder, but does it mean that they're lying when they say I'm panicking? Does it mean that you're lying if you tell them you're panicking? Like if you can see that they are hyperventilating, they can't breathe, their breathing is restricted, they can't swallow, they feel like they're gonna die, and they're like, I just can't get out of here. But there aren't in, they're not enclosed in a particular space. You're asking them to calm down, and they get even worse. You can easily say, with no more questions asked, that they are panicking. Do you agree?
Yeah.
That doesn't mean that you diagnosed them with panic disorder.
And a lot of them, a lot of disorders are, I mean, they're invisible to people that, I mean, you just walking down the street unless they're completely, um, I don't want to say and not acting normal because everyone's normal isn't normal. Um,
But you say, so the way that we gauge norms when we're thinking about the clinical significance of it is societal norms. So
mhm.
if we've taken a history taking of your your Christian background, your Catholic background, whatever your cultural and spiritual beliefs are, and we've taken a history taken of what your family of origin looked like and what was expected of you and how you've been conditioned in that component. These are things that contribute to what your norms are. The way that you responded to said conditioning contributes to what your norms are. The way that you've behaved over the course of your becoming versus now, and anything that could have been a precipitating factor that could have changed the way that you're responding and behaving now. These are things that we look at to gauge normative versus outside of normative or clinically significant distressful situations that are subject to a particular diagnosis. Because we also have acute distress disorder and adjustment disorder for people who are struggling with just, for short periods of time with said issues that are presenting.
And we've talked about this culturally too, because like in doing like the podcast on the Disney characters, we can't, well, we haven't done Pocahontas yet, but we talked about this. You can't diagnose her with schizophrenia. Um, Culturally, like you have to look at all those components.
Yeah.
So that's why it takes a professional to make certain diagnoses, because you have to dig, like you have to do research. You have to take religious, cultural, spiritual considerations. You have to take, like you were saying, Dr. J, you just have to take an inventory of everything um,
In
that's
order
going
fully
Lord.
understand, fully comprehend it.
I mean, and it could take hours.
Yeah. And here's the biggest part right here. We're here for accountability tonight, and it was really interesting. The person who sent me this accountability story for the night is another clinician, and um here is the thing, okay? Oftentimes I caution myself before I just check other clinicians because I feel like we're so different across the board. And um everybody has their own thing, and perceptions are what makes us individuals, and our individual perceptions typically shape our outcomes. Now, when it comes to understanding the capacity of some of these questions when they're submitted to me, I have to have all the details. So I have to look at the context in which conversations were had, how these responses could have been, I mean, how the initial communication could have been taken by the person and things like this. And so, one of the things that I've talked about on this channel, because I oftentimes talk about accountability issues as it relates to just the Black and Brown culture in our community in general. But as professionals, I feel like clinicians are people that are held to a much higher standard of being, simply because we're the people that have navigated very difficult trainings, very difficult experiences in order to gain our tenure. It's not easy. Okay. And so if you've done all of that and then you vacated that stuff and you've washed it away, and you're now, so emotionally moved that you don't know that you need to remain balanced and get yourself a therapist when you need a therapist, then that becomes an issue. Okay. So there was a person who sent me a request to review her interactions with a person that was in our Black community, and this particular person happens to be non-Black. Okay. In this communication, they are both clinicians working in a clinical setting, providing two different types of services in a core agency. So many of you will not know what a core agency is, so you can hold your comments because that's just too much explanation. But just know that a core agency for mental health providers is an agency that's definitely always under scrutiny when it comes to the possibility of fraud. Okay. For a lot of reasons. For a lot of reasons. And I don't want to give this young lady any, any passes or whatever. I'm going to be as authentic as possible, because at the end of the day, everybody is deserving of accountability. So I'll throw the scenario out there, and I will let that LCSW Dominique respond as to how she would take said communication from me, you know, if I were to send said communication to her. Okay. So there was a discrepancy as I'm billing for mental health services that I've provided for my client. And I know that Dominique is assigned to the same client. And when I'm going in to put my hours in, the system is kicking me out saying that there is um, double billing. So for the time that I'm trying to bill, another clinician has already billed for services. Okay. So what do you guys think that means? I'm just going to ask people that are non clinicians. What do you think that means? But I'm going to go on with the story. Um, so as I see this, I look into the system to see who is it that I'm double billing with, because I know what times I was with my patient. I had an appointment schedule. Hey, Stranger Talk Live. He's speaking to you too. So I had an appointment scheduled with this person, and I've seen this person at the appointment time that I had scheduled, and now I'm seeing that Dominique has billed for the same time that I saw this person for. And I know that my appointment's been set for a while. My watch isn't crazy. I'm not crazy. I'm not losing it. So I contact Dominique directly via email and I text her the following. I want you guys to listen and tell me how you would feel receiving this email as well. And if there is anything that would change your perspective if you were sending, I mean, what would I have to be for you to accept this email? Okay. Hey, Rush, how are you? Okay. So my email states very clearly, hey, Dominique, I noticed that I saw Jane Doe, and you saw Jane Doe, and we saw them on the same time according to the system. However, I know you didn't see Jane Doe during this particular time because I was physically with them at that time. So I think maybe there is something wrong in the system, So can you go in there and, double check your notes and your time and recertify what time that you've seen Jane Doe? Because I know that I saw Jane Doe from such and such time to such and such time. Okay, let's say 3 p.m. to 4 p.m. And so how would you feel at that point? And tell me, you guys, how would you guys feel receiving that email from me? Tell me how you would feel, Dominique.
Like called out a little bit.
Okay, called out.
But like, oh, it depends. Am I assuming that I did? Is this an assumption that I did something wrong, or that I have mistakenly put the wrong day?
Well, did I say you did something wrong in my email specifically?
Mm-mm.
Okay,
No,
so
so it's how you. It might be how that person took it. Like, are you coming at me, or not that you said anything offensive, but am I assuming that? So I know a little bit of the backstory. So I'm trying not to. I'm I'm trying to. It would be different if I didn't know it.
well, you didn't. I only gave you the basics.
Um. So personally, I wouldn't respond back in a negative way,
Mm-hmm.
but that's just my personality.
Stranger Talk Live. Do you feel like would you feel offended if I sent you that if we work together and I'm telling you that you're billing for the same time that I saw somebody? We both saw somebody at the same time. What about you, Casey? Would you feel offended? What are some of the other things that you might think is going on, Dominique?
Maybe you got the wrong day because I mean people do that, accidentally bill for the wrong day. Um, that's the I mean that's the only other reason, unless it's like fraud, unless you blatantly, yeah, I'm seeing this person, but I'm sitting on the couch watching cartoons like that. There's only two things, unless you know something that I don't.
Got to call a spade at the end of the day, right?
Right,
So, unless Dominique is out here living her best life, watching TV and billing for the same time that I'm doing services, somebody lying, right?
right.
Miss Sandy, what's your question? Says I watch movies and TV shows and people in mainstream media that defines the word insanity as a person that does the same thing over and over and expect different results. Can you explain that to me? Well, I mean, that's the definition of insanity is to do things multiple times and expect something different to come about after you've done the exact same thing and the same pattern of behavior has been consistent. So one could say that it is insane. I don't think that has anything to do with mental health though. That insanity used to have more to do with mental illness, and we no longer persist in the space of mental illness. So we deal with psychosis now, not insanity. Insanity is not a technical term. No, I'm not sure where you're getting your diagnosis from, but there is only one diagnostic manual of mental disorders, and insanity isn't one. Like I said, that's our Bible, literally. So, but yeah, so if we're seeing someone and you're billing for the same time that I'm billing, typically that would speak, if I'm an auditor, right? It speaks to fraud happening. So, have any of you ever experienced a situation where your doctor called you and said, "Hey, your claim was denied," or a claim was denied on your file because it's, someone else billed for services on that same set day? Because there are some diagnostic codes, um and sometimes people make errors in the times, and we have to resubmit claims, right? So when we call the patient, or we call the other provider that we see is billing for the same time that we know we saw patients in our office, that courtesy call is typically not taken as offensive, not unless somebody is being fraudulent, right? Right, Stranger Talk Live. But yeah, it's not a mental disorder. So mental disorders are only classified inside of the Diagnostic and Statistical Manual for Mental Disorders, um, and concurrently in the ICD-10 manual in the medical field. But they're the same congruent diagnoses. But so this particular situation, um, what word exactly? How many DSMs have you looked in? I'm just curious. I mean, I don't mean to be insultative or anything like that, or condescending, but you would have had to, you kind of got to be, you got to look in these DSMs. You have, and then be well versed in them at that. Quite complex. And insanity is just not in there because we don't deal with that. It's not a mental disorder. Though people can have those types of behaviors and still have diagnosed, confirmed diagnosis, of particular mental disorders. But so can't with you, Dominique. But so here's the thing. Um some people some people are doing fraudulent things, and that's fine. Do what you do.
It's not fine.
Yeah, it's fine. It's fine. It's fine.
It's not fine
Do what you
unless you
do.
don't want a career.
Right, right, right. So that's what I'm getting to. Do what it is that you do, and that's
Look, you
exactly
can
where we're
told
going to jump.
somebody to break their phone,
Yeah, all of
and
it,
you just
all of it.
said
Throw it in the
it's
trash.
fine.
Throw it in the trash.
No,
So
continue.
let's look at insanity as Miss Sandy is putting it out there. So if you are a clinician and you're out there and you're doing fraudulent activity, you're going to be a person who is extremely sensitive to someone holding you accountable. Period. Point blank. Personally, in this particular situation, right? Right? Like, nobody is offended. Nobody is offended. Nobody is offended unless said somebody is out here committing fraudulent transactions,
Yeah.
right? So, would you be offended if I sent you that email, Dominique? Would you feel like I'm accusatory in that email based on the language that was used?
No, because I'm not committing fraud.
You
Like,
sure?
come on now. No, if I got that email and I did something wrong, when people do things wrong, they automatically get on the defensive. Like, I'm not doing this, you're doing this. Like, I didn't say that you were doing this, but now you showed your hand. But if it were a discrepancy for me, it's got to be the wrong day because we got 48 hours to do our notes. I can tell you I'm doing it on the 47th hour most of the time. So to get the date wrong, that's it could happen. So for me, it's gonna be a date because I'm not out here just putting out and seeing somebody and I did it. I don't like the extra work of notes to begin with. And I don't need the extra just to say, yeah, I seen this person. I'm good with that because I could lose my license. You can lose your license for doing that.
Literally, not only lose your license, but you can go to jail. Like, I don't know, like some people like jail, and personally I'm a person who doesn't like jail. That's kind of not my thing because I got a thing when it comes to places. That's one of my PTSD triggers. Like, they have white walls in there. It's just not good for me. So I don't want to be locked up. I don't want to. Like, I don't care how much money comes along with it. And trust me, I've seen millions of dollars in Medicaid fraud, okay? I'm going to be very honest. As a clinician, I have seen things happen. I have broken business agreements. Like, I have paid out shit tons of money to disassociate myself from other clinicians because what I will not do is go to jail for you. Just not gonna do it. I don't care. I don't care and I don't care. I'll lose all my money. I do not want to be associated with or affiliated with any type of financial fraud. Now, Medicaid, first of all, pays very slowly. So I don't even know why people want to do the things that they do and then want other people to accept it. But here's the reality. I have yeah, hold on. I needed to send a message. But yeah, so I have previously in my life experienced situations where people were double billing, because that's what they call it, double billing in the medical field on the same hours clinically that I was billing on. Okay. I know my schedule is tight. I see my clients. When I see my clients, there is no moving away from that. So I need you to recheck your notes. If I received a note like that, that's my response. Why? Because I do concurrent documentation. So the moment I close that note out is when the session is ending, and that is the time that I'm entering on the note. The moment my session starts is when the person is coming into the room. And so Mm, that's exactly what it is. So for me, I'm not about to change or modify anything for your to fit your needs. So I feel like if if any fraud happens, it's easy to catch it because some people are there for the moments in which they're doing things and work. You have to be very careful when it comes to these things. And let me tell you something, double billing can happen even if you're billing on the minute, right? So if somebody has a patient's appointment scheduled for 10 a.m. and they saw you from 9 a.m. to 10 a.m., then you have to bill from 9 a.m. to 9:59 or whatever time you actually ended your session. Okay, let's put it like that. Because there's no way that they could be in your office with you at 10 a.m. and in the other person's office with them at 10 a.m. Do you understand what I'm saying?
Now, I also misspoke. So there are a couple other reasons why they could be double billing, but it could be a different service.
Yeah,
So were they
I
doing
said
case
that too.
management and
Mhm.
looking through notes? Were they like, I think the meat and potatoes is that we are professionals and we have to, like, you should go to that person first.
Yeah,
Hey, this happened. I noticed this. maybe you should go look at this. That's a professional courtesy.
Right. So if I'm coming to you first, then you shouldn't feel disrespected. You shouldn't feel slighted. You shouldn't feel like I'm trying to accuse you of anything, any of that. So I think that we have to be careful, because here's what it says. If we are people who are out here defensive when someone comes to us politically correct in the workforce and say, "Hey, we have a service that both of us bill for the same periods of time, but I know that I was physically with this person." If it's not a case management service, so case management services are things that you do on behalf of the consumer, could be making linkage or resource or whatever. This clinician had the nerve to pull the race card. And obviously, you never mentioned anything about race when I told you what the, message said, right? So did you feel racially oppressed?
No.
Is it because we look the same? Like, help me understand. Like, if I were a white woman sending you that message, would you feel oppressed then? Would you feel offended then?
No, like you have to look at yourself. Did I do something wrong? Meaning, did I commit fraud? Did I make a mistake? Or, like,
Fraud. I
or
never
you,
said you were committing fraud, though. I just said
yeah,
that we're
I'm
built.
saying you
You
have to look
build.
at yourself.
Yeah, you
You
do.
don't it's accountability. You don't just go lash out at somebody because they sent you a message and it's like they trying to help you. Now you can go tell somebody else, one of your supports, so and so tried to pull this on me. But why would you go tell that person they trying to help you? That would make me not want to help you anymore. I mean,
Exactly, because it tells me that you're with that stuff that I'm not with. Like, you with the shits, as they say. Like, you're out here, you're doing fraudulent activities. So let me get to these comments. So
it's still about insanity.
okay, Miss Sandy says that's not the definition. No, you don't think so? Insanity is a serious mental illness. No,
State of serious mental.
no. So insanity is a legal term now and a lay term now that speaks to states of manic states of people. Manic states look very much like you're describing an insanity, to be honest with you, because they can be very incongruent with any, solidified outcomes. So it's non-outcome driven behavior by people that typically look very repetitive in nature, but those people are not aware of those said behaviors. So I think that that's what you're looking for. So they used to have insane asylums because lunacy used to be a thing back in the day, in the early 1900s. However, in the mid 1900s, we started to move away and phase out of insane asylums. And then in the 1990s, more specifically in America, um, residential treatment facilities became a thing instead of long term asylums. So there are none, period, in America because they're outlawed. So even your state hospitalization programs and things like that, when we go in and we admit people and, forcibly, because they have to be 1013 Baker's Act, whatever your state calls it, but the form that we fill out as medical providers is a 1013. It's an involuntary hospitalization form. We don't just fill it out for episodes of psychosis or mania. So it's a lot of things. So we go off of whether or not the person is suicidal, homicidal, or psychotic. Those are the three conditions that have to be met, one or the other. But so I think that you tying that into a serious mental illness is just a misstep. Like I said, the ignorance is definitely there because you're not a clinician. So I don't expect you to know anything about this. If you're Googling definitions, there is no comparison. I'm just going to be honest. But I've explained it as much as I can.
It's
Um,
actually not okay to call someone insane. As
I
a
mean,
clinician, I would never, I mean, I would say, I mean, it's like a label, like you're insane.
Well, it can be. I personally, as a marriage and family therapist, we move away from labels altogether, and we move away from people associating themselves with a diagnosis, because we need people to understand, in order for you to mitigate a diagnostic condition, you have to first separate yourself from it. So you have to externalize it, and that's a process as well. Um, by the way, dictionaries have been ineffective for the last 2 years, because they've come up with too many technical terms, and they have now redefined the way you spell several different words. They have a separate urban dictionary for Black people. There are several different, yeah, on a scholarly level. That's why American society has vacated them on a scholarly level, just going off of that.
I think that they have several different definitions of different words as well. So doing the same thing, expecting the same results. I think that, it's just, I think it's something that people say.
It's
Like,
it's descriptive of behavior. So mental illness, mental disorders are not descriptive of behaviors. They're descriptive of diagnoses. That's a different thing altogether. So there are many adjectives out there, okay, to describe many things, but they still don't have anything to do with mental illness. They don't. Just going to be honest with you. Even when you look at the legal term, because insanity pleas are still definitely a part of the process in the law or in courts or whatever. But insanity pleas are based off of acute psychosis, not even manic episode or manic behavior. But the word insane is associated with lunacy from back in the day, before we moved away from, you ever heard somebody call somebody a lunatic? That's what they mean by that. They're calling them a crazy person, an insane person. So the word crazy and mental disorder are two totally different things. So you're talking about something that is societal subscribed and something that is medically subscribed. There, we don't have a label for crazy in the medical field. So there is no medical manual, code book. We can't code that. So for every diagnostic disorder, we can code. We can't code crazy. We can't code insane. And insane, just to be very clear, has never been included in any DSM. None of them. Lunacy, however, has. So the social equivalent of what the label meant for some people to be a person that is receiving help from a psychiatric practitioner, which back in the day was considered to be a shrink, is very different than mental health providers treating mental health disorders. So hopefully, hopefully that clears that up for you. Um, but there is no paperwork behind it. Right. Exactly, Casey. I told you, like, it's not you can't make this stuff up. People, there is insurance fraud everywhere. People are gonna do what the people are gonna do, and that's why I said it's okay. If jail is for you, if you okay with that, you know, right, right. Stranger Talk Live, you're fine. Don't go light a joint. That's gonna affect your brain. Next, you're gonna tell me it's an unlimited amount of genders. Well, you know what?
another topic.
That's a whole different, yeah. There's only two genders, Miss Sandy. Only unlimited labels for right. Gender identity is different from gender assignment. Well, technically, Stranger Talk, there are three assigned genders. Although many people, most people, don't have the third assigned gender. Not in America, anyway. We haven't seen it. They consider it to be a birth defect in the medical field here in America, because some people are definitely born with both um, physical presentations of genders. Good God, he said he never got caught. Listen, listen. I don't know nothing about nothing, and I ain't got nothing. Listen, listen. We have an ethical and legal obligation. You know, Dominique distracted me talking about my sandwich. Um, to inform things like that. So it is what it is. Okay.
People get chummy and they feel bad, like, oh, I know he doing this, but I ain't gonna say nothing. We coworkers.
Right. But let me
So
tell you, you can go to jail because the thing
mhm,
is, if
y'all
you
gonna
know
have matching
something,
jumpsuits.
if you right, so I can't go to jail for anybody. I cannot go to jail for anybody because you can't get your nails done in there. You can't wake up when you want to in there. You can't do your whatever exercises you want to do. Can't go to sleep when you want to. You can't even shower when you want to. You can't even listen to music when you want to. It's so restrictive. When I see my prison population, I'm starting to really see why they're depressed now. I'm depressed for them. I'm telling you. Right. Yeah, I agree. I agree. And this is a volatile field, but that question, believe it or not, came from closer to where Dominique is in Ohio. Well, I'm not gonna make any money then, and I've made a lot of it, but I sure don't want none of the
Right.
unscared money. I'm scared as hell. Scare me into freedom, okay? Scare me into freedom. So I am definitely on holding this woman accountable. I really hate it though when black people pull the race card for everything and call it a microaggression. Like that is
I don't think she didn't know that she didn't necessarily know that she wasn't black. So how could you say, "Oh, you're microaggressive or you're being racist or?"
here is the situation. They worked together and they had seen each other on Zoom calls, but the black woman had never turned her camera on the Zoom calls, and she had saw that the other clinician was a white clinician because she's seen her face, so she knew that she was white. The thing is, you knew you were wrong. So accountability says that you're you know that you're fraudulently built. I'm not even going to say double billing on mistake. You know that you're fraudulent in your transaction, ma'am.
She's probably kicking herself and backpedaling and probably going to apologize tomorrow. Probably not, but wishful thinking.
But that's what I'm saying. Like, my thing is this: she's not gonna do anything because you know what? The moment she hit that racist card, what do you think the agency did? Because this is my biggest problem with this.
I mean, did the person tell the agency, because there are steps to doing
Yeah,
that?
yeah. She went
If
to
this
the
was her
supervisor
third,
and said, "Hey, this person sent me this message, and
oh,
I feel, we got to use them I statements. I feel
nobody can tell you how you feel.
this was a microaggression because I'm black.
Hmm.
That's all it takes. Let me tell you something. You want to stay in business, better take them people seriously. You better take them people seriously. Period. Okay. So the thing was, they then contacted the clinician who had been directed to contact people face to face, on person to person, and then told her, "Well, we're not gonna, we're not. Let us figure out how to handle this first. So don't even say anything. Even if that person sends you a message, don't say anything. Don't even say hi. Don't even say hi. Because the difference is, let me tell you something, you guys. You know what this says? This says that, man, I'm gonna really hate to say this because it's just gonna have to come out because it is what it is. It says that white people are more acceptable when it comes to accountability than we are. It says that we, as black people, refuse to take accountability and we refuse to own up to the things that we do that we know are wrong. Like, it's not like, well, let me just see if I can sleep my morning through, but I'm still going to bill for these 4 hours. Let me just pick some clients to bill these 4 hours because it's a lot of clients to pick from. Like, here's the thing, if you're going to be a criminal, be good at being a criminal. And at least get to know your client's schedule with the other person. And I mean, come on, like, you don't make it so
Now,
noticeable.
well,
And I'm not
I
promoting that
can't
you
say
guys go out here and do this. By the way, I'm not out here like Kevin Samuels and inciting domestic
this.
violence, which y'all not gonna do.
Everybody is capable of committing fraudulent claims, though.
No,
And everybody
fraud.
is capable of being accountable for when they are committing fraudulent
So
claims.
here's the thing: everybody is not capable of committing fraudulent claims. No, no, ma'am.
No,
No.
everybody is capable of the ugliest things in the world, but it
Hell
doesn't
no.
mean that
Because
you're
if
going
they
to
don't want
do
to go
it.
to jail, they're not capable.
But
They're just no.
they're capable. You're capable of doing
Mm-mm,
anything.
mm-mm.
But will you do it? That depends on your morals and your values and
It
your
could
ethics.
be, it could, let me tell you something. I have people that have generalized anxiety disorder, and guess what? They will overthink it before they commit the crime.
But it doesn't mean that they're not capable of typing something in and saying, "Oh, I saw him this day and this time." It means that
But that's not
morally and
fraud.
ethically, they're not going to do it.
But that's what I'm saying. That's not fraud, though. Just typing it in and of itself, it's not the fraudulent act. It's the intent. So you know that you didn't see these people during this time. That's what makes it a crime. So you can go to court, and if it's an accident, all they're gonna do is require you to pay the money back, and it's just a slap on the wrist. You're not going to jail, but ma'am, if you go out here and you bill these hours for hours that you didn't see this person for, you can't account for what these people do in their lives. Even if they come and they tell you, I'm depressed every day for most days of the week and I don't leave my house at all, you cannot go in there and just pick a day to bill a service knowing that you're not seeing that person, don't have an appointment schedule. Because guess what? They could be going to the doctor's office, they could be at the hospital.
No,
Somebody else
I'm
is
not
going to bill
saying
that
that.
same time.
What I'm you're right. What I'm saying is everybody is capable of horrendous things, but morally, ethically, and according to their values, they probably won't do it because they're thinking about XYZ, like what could happen if I do this. So even the cleanest clinician
I'm
has,
not capable.
like, you don't you
I
you're
don't have the
capable,
capability. Let me tell you, I don't
but
have the
you're
capability.
not going to do it because morally you can't get your nails done in prison.
Exactly.
That's
That's the
the thing.
problem. So I have the ability, but not the capability. You see, capability means that I am willing to weigh in the pros and the cons. I'm not even willing to weigh in nothing because at the end of the day, after all of this, I'm either gonna lose money or I'm going to lose time. And I don't want to lose either. I don't even gamble. Let me tell you, I don't gamble for a reason. I see what happens to people when they come in to see me for addictive behavior, for gambling disorders.
Nope, I can't lose my money.
Great Stranger Talk Live. Great.
Right, that's good.
But yeah, those are things that for me I just don't juggle. Like, I don't care. You can give me $20 to gamble with, and I'm gonna cash out the $20. That's
What
it.
you gonna get, a sandwich?
I'm gonna go get me a sandwich. That's right. Right. You're gonna be like, but we gave you this card so you could play it in the casino. No, no, I don't want to lose. What's the probability of me losing? I don't even know how to gamble. Like, I'm gonna lose it anyway because I don't even know what I'm doing.
Scared money don't make no money.
That's right. Like Casey said, I'm scared of money. I'm gonna be broke as hell.
I'm scared
Somehow
to
I have
lose money.
avoided it. I can't with you. You said the definition of a criminal is someone who commits a crime. The definition of a crime is any act that constitutes an offense that's punishable by law. So, no. The definition of a criminal is someone who is convicted of a crime. Otherwise, they are an alleged criminal. Let's get that straight really quickly. And there you go. That part. Everyone over 18 commits crime, but not everyone has been caught. Like I said, intent is what you can prove. So listen, it's what you can prove. It is what you can
I
prove.
think you're just saying it's a crime. Like if I go speed, if I'm five over, it's a crime. I'm not a criminal.
You're not a
I
criminal unless
haven't
you've
been
been
convicted.
convicted. Yeah, you're not a criminal unless you've been convicted. You've not even convicted a crime. Look at
How is
read
that?
your citations. Have you guys not read your citations before we get tickets?
You gotta. Well, never mind. I don't get tickets.
I'm a reader. Citations can even be warnings from police
If
officers.
you
So
pay your if you pay it and you don't go to see the judge, then
it doesn't always equate to a conviction. Sometimes it's no low contender. So if you have to, can you shut up? He's so loud.
with the sandwich.
Right. He don't know how to be quiet. He can't sneak in, you guys. But so if you, so let's think about it. Let's go down this pathology right here. This young lady knew she was wrong. She knew that she would be committing a crime. Hear my words. Would be committing a crime if she billed for time that another clinician billed for. Do you guys think that she billed for that said time, knowing that another clinician saw that person at the same time? I'm
Say
listening.
say it again.
Do you think that she billed for the time, knowing that that person had an appointment with another clinician at that time?
If that was her intent to bill fraudulently, yes.
No.
Or no, I mean no, yeah. No,
Right.
sorry.
Right. So at the end of the day, if my intentions are to not get caught, that is criminal behavior, but nobody can call me a criminal until I have been prosecuted for said crime and found guilty, so therefore convicted. For example, Derek Chauvin. The world saw this man murder somebody, right? Why do you think they have to select a jury that is not aware of the issues that are being presented in court? Why do you think that is? Because you don't want somebody assuming this man is a criminal. You want them to only judge this guy based off of the facts that they are presented. So in criminal legal entities, right, it's about what you can prove. So I'm pretty sure that the clinician who said something, can you stop messaging for my name? God, that's just, and then you don't even properly formulate the sentence. What are you doing? Pecking on the thing with one hand and eating with the other one. It's terrible. I'm gonna mute my camera. I'm gonna mute my microphone so y'all can't hear him because he's just too much. So when he shut up, then I'm unmute so I can talk. That's what you call oppression, Miss Sandy. Look, where's the dude that was on the official Urban Therapist platform that said I disrespected him? Call him and let him know that that's disrespect right there. That's look. He said when I muted him, Dominic on my show, he felt disrespected. I can't.
Got to see it through.
But yeah, so my thing is this. Derek Chauvin wasn't a criminal until he was convicted. You can't say he's a criminal until he's convicted because you could be a person that tamper with his jury. If you had a conversation with a jury member, I'm just saying that's
Why
they
you
can
bring
have
that up?
cause
Look,
it's a sensitive one for us as black people. So why do you think so many black people were restrictive? Black people were very restrictive with the way that they handled things around the Derek Chauvin case because black people wanted to make sure no mistrials were declared.
historically, as they should, but another topic for another discussion.
I'm just saying. But so I want you guys to think about this. I want you guys to kind of sit with it a little bit and think about the accountability components here. We, like they used to say back in the day, a hit dog will holler. Okay. So if you are that hit dog, when you get that message from somebody that has caught you and called you out on your stuff, and you're out here fraudulently billing and stuff like that, you're gonna be a person who is defensive and you're going to be pulling the race card. Black people, stop pulling the race card and stop calling things microaggressions if you don't know the term. If you don't know what the term microaggression means, can you please just state that now so that we can clear it up so you can at least go forth with a greater level of understanding so you can properly use the term. God, because it's I get sick and tired of seeing it. I got I got black clinicians that tell me every single day, Miss Sandy, go look up microaggressions for us since you're so good at Google today. But so you guys gotta understand. Like I hear clinicians say, "Oh well, my client came in to talk about how they felt disrespected, by the black community because people are only talking about black issues right now, and they feel like they can barely go outside and barely enjoy their life without hearing." Conversations about what's going on in the black community, blah, blah, blah. Um, and let me tell you, black clinicians are in groups and they say, oh my God, I had this triggering moment today in a session. My white client was using microaggressions against me and blah, blah, blah. I'm like, okay, so where are the microaggressions in that narrative? Are you telling me you're really a clinician and you can't sit with other people's feelings? You can't create space for them? You should be referring out immediately. It's unethical and it's illegal. Just refer out. Just refer out. So hopefully for the person that sent me this issue, hopefully I've done you some justice. I've reviewed this thoroughly. It's no racism where it's just fraud.
Just do better.
Being fraudulent doesn't make a person racist against you. That just makes you fraudulent. And and obviously you're not good at it. That's the thing. Have you ever heard some people should not be criminals? I'm one of those people. So listen, I understand you. I feel your pain, young lady in Ohio. But look, if you know that this is not the life for you, don't lead that life. Like some people just can't do these things. Let me tell you, some people just can't. And if you can't, just take the high road and walk away. Do your due diligence.
I think
Like,
that
like
an example of the email would have been you people always
right.
double billing and you ain't even there. Had
Oh
you said
God.
that,
Oh God.
microaggression, it's the you people
Yes.
to me,
Yes.
or
Yes.
all y'all do is
Right. Right. So I can see it then. I can see, okay, did you generalize in any way? Did you say hey, black girl in any way? She was like, I didn't even know that she was black. I had to see her. I had to go back and review the meeting where all of us were on in order to see that she was a black woman. I was like, what do you mean racist? That's not me. I'm not racist. Like, you know? So it was just
Did she tell
interesting.
you I'm not racist? I have a black cousin or a black friend or my kids are black.
No,
Okay.
no. She has
Or I
white
don't see
kids. She
color.
has a white
I don't
husband.
see color.
Huh?
That's I don't see color.
No, she didn't say she don't see color.
Okay.
She's American American, but I personally truly I don't see color. I see people because I don't look at people's pictures when they email me. The fuck? Who does that? Who's doing that? Like you work for an agency. Do you know how big these agencies are? And since COVID, you got so many clinicians around here with so many different names. You don't know what who is like. And I'm not out here doing no research to find out what color clinician you are so I can find out what your face look like and all that. For what? We work together. Just be on the phone, on the conference calls or Zoom calls or whatever we're doing. Speak your piece. I hope it resonates with me and helps me with my caseload. Let's staff the cases and do what we need to do to get people to a better and a higher level of functioning and get the fuck off the phone. Like, what are we here for? We're not doing all that extra stuff. Your race does not affect my work. Your race does not affect your work unless your race has something to do with the way that you see the world. And therefore, it has some way that it's affecting your work with other people of other races. So I think that on the flip side of this, we need to be asking ourselves as Black clinicians, like Kevin Samuels made a very clear point, and I don't even like the guy. Are we as Black women fit to see Black clients? Because this dude is like, man, this is the second or the third therapist that I've seen. All this extra stuff. If let me tell you something, if you're a clinician and you calling Kevin Samuels for any advice, please know that I am currently questioning your clinical competency.
Producer is right.
Yeah, I just can't. I am internally, externally, all of that because you should know better. You should know better. Like writings on the wall. This dude did a whole freaking interview. You know everything about him that he decided to share. Says you don't have a reason to not like Kevin Samuels. He didn't do anything to you.
Yeah.
So specifically, I don't like people who don't do particular things that for their families that they're supposed to. And I am a person about accountability. When I got ready to review Kevin Samuels' content, I did a comprehensive interview with his ex-wives and his child. So I think I know a lot about him. A lot about him. And for those reasons, I just don't like the guy. Definitely don't like his content. And I can't say it's a lot of people on my list of unlikables. So it is what it is, you know. However, I am compassionate to families. So families are what they are. And I understand that people make mistakes, but people have to also be accountable for their mistakes and stand up and own them and do what they need to do to make sure that they are congruent with helping their children actualize and get to a better level of functioning and healing the trauma that they put into their children as parents. So as long as he is a person who is not doing the work within his family system that is a Black family system that contains Black women, I have an issue with Kevin Samuels. Furthermore, he's a dude that has openly said that it's okay and encouraged domestic violence against Black women on a public platform 3 times. So, to be honest with you, I feel some type of way about that because this petition should be legal injunctions against him, just like they have had several arrests in Tennessee the last couple of years for inciting violence.
Chill out. Chill out.
Only Dominique. I
Chill
just
out.
can't. Stranger Talk Live. What do you feel about Miss Sandy? Somebody bring
Certified
up somebody bring up Kevin Samuel's response
Kimoji.
to
It's
Lapeep
about a
Jr.
lot of things.
Just that's his most recent one. His response to Lapeep Jr. and Anton. They asked him, I think it was Anton talking about he has a very disrespectful sister, and women typically be disrespectful to black men in the black community. What would he suggest as a means to, get women back in their place, because women, modern day women, are disrespectful? He said, and I quote, there comes a time when it's appropriate to slap a woman. That's what he said. Because sometimes a woman doesn't know her place and you got to put her back in her place. He had a comprehensive conversation about it. And then he went and started talking about, well, wait, have you guys ever heard of domestic discipline? By the way, which is not a pop culture topic, doesn't relate to the question he was just asked and he just answered in any way. It's an alternative lifestyle topic that applies to BDSM culture and kink. And said, yeah, men have to whoop their women all the time when they step out of what did it say? Step out of line, and they lay them across the knee and take the belt to them and whoop the woman, and just like they do the children. Objectification of women, 1. Domestic violence, 2. And right, physical abuse of another person, another human being, 3. Need I go on?
I like the official urbans, in the criminal justice system.
I'm so done with the official urban therapist.
The Godfather. Dead.
Yeah. But yeah, so Kimoji, the topic is accountability around the mental health component. There has been a situation where a mental health provider received an email from a coworker stating very specifically, not alleging, that she double billed for time that this other clinician spent with the consumer in question. And that clinician pulled a race card and said, oh, this is microaggressions, blah, blah, blah. You're racist. And she pulled a race card and contacted the supervisor and said that she received a racist email from said person. Mind you, the supervisor was tagged on the email in the beginning. BCC. It's so interesting the way people do stuff. Just, it's just, she was, at the end of the day, she knew she had, as they say, she knew that was when she knew she fucked up.
That's an important thing to add. I didn't know that the supervisor was CC'd all along.
BCC. The supervisor has to be BCC'd on all contact between all people in that agency. That's how they run.
That was like telling, but as a professional courtesy, you always talk to the person directly. And if things are not settled, then you go through the different channels and eventually talk to the supervisor. So I wouldn't have told her she was being racist or microaggressive, but I would have been like, what you
snitching on me?
No. What are you trying to do here? Especially if I made a mistake.
Well, even if you made a mistake, send an email back like the other 14 people before you.
Because now you snitching. And why? Because I haven't done anything.
Oh, God. So there we go. With the snitches get stitches.
No, snitches don't get stitches. But I'm saying, like, why are you trying to come at me as if you're telling on me? Because maybe I didn't do anything wrong.
Well, it doesn't
maybe
mean
I
that,
billed for the wrong day.
So do you think that it means that you're doing something wrong? If I'm just saying.
I'm trying to be serious, and this conversation.
I know. I say that all the time to the producer. I'm like, why do you even put these comments up if you're seeing them talking? Like, you want to take me off the topic? Like, I don't know what kind of producing you're doing.
No, it's no. No disrespect to the producer. That's all.
As they relate to the conversation at hand, put the comments up. Otherwise, they can all see each other come. You see those red YouTube things? They can all see each other in the chat. Like, what we
I
doing?
appreciate him, Mr. Producer. But what I was saying is,
I'm about to mute my thingy.
when I see someone, I'm telling. I'm just like, per my last email, and then I'm CCing somebody. I'm not off the bat saying, "Oh,
So
I think you're double billing, like you're fraudulent."
that's no double billing and fraudulent billing are two different things. Double billing could mean that we're on the minute. Both of us are
No,
on
I
the
get
minute.
that.
So you could be billing from 9 to 10 and I could be billing from 10 to 11 and we're still wrong. Somebody's got to go 10:01 to 10:59 or anything's 53 minutes plus is paid at the same rate anyway. So what I don't understand is why it is that if you're explained that, which you should be if you work at an agency and you know these are trainings that you definitely should have gone through, right? Like oh God. Go ahead, Dominique. Answer it. Let me I'm not gonna judge you. Let me take my face out. I'm gonna eat my sandwich.
I don't listen to things that aren't for me. His opinions are not for me. I hear about them, I laugh at them, I walk away. So I don't necessarily have an opinion on Kevin Samuels. I just don't think that he's a god or a godfather or anything like that. Oh, I don't I don't understand why people feel like Kevin must be protected at all costs. What does at all costs mean? It just means that somebody is trying to
Go to jail.
telling the truth, like he's telling all these truths, and they need to protect him because somebody might try to off him or something because he's telling all these truths. He's identifying or he's revealing something that is very valuable. So that's what I
That's what at
understand.
all costs mean though, no? Because at all
No,
costs
that's what I'm saying. At all costs. That's what that means.
mm-hmm.
Like with people say the same thing about Dr. Umar. Like I look at things for pure entertainment purposes.
He's accepting applications for wives.
For what?
For wives.
Okay.
Oh God.
Turn the camera off so you can have your sandwich.
Mm-hmm.
But no, I don't necessarily have an opinion. I'm not I don't judge people. I'm not here to judge somebody. I just look at I laugh because
Okay, go ahead and protect the producer at all costs. You're gonna get blocked. That's jail.
No, come on.
This is jail. The producer has been invited on the show to give his perspectives, and he wants to hide behind the camera.
About Kevin Samuels.
It might be about him. It might be. It may be.
He has a lot to say about Kevin Samuels behind the scenes, you guys.
What about him?
Go ahead, producer.
I did hear about the little bit about the bonnet thing. I love wearing my bonnet, and my husband loved my bonnet. He loved my ponytail. Like anything I do, he for it. So I found a high quality man wearing my bonnet, and I wear my bonnet in these suburbs while I go check my mail. And damn neighbor better say anything because it's my bonnet.
But also,
that's my opinion about what Kevin said.
Okay, wait. So, but also, how many black men and how many black women were around when you found your husband?
How many were around?
Mm-hmm.
What you mean? Like he didn't have no other options? What you trying to say?
look, I'm just doing the Kevin Samuels thing. That's Kevin Samuels.
No. He had plenty of options.
Okay,
we met in high school. He had a long period of time where he could have found somebody
Mm-hmm.
and he didn't want them people. He wanted me.
Okay.
Let's be clear, Dr. J. I should bring him on here.
Mm.
Wait, Mary, so I have no dog in this fight. About what?
That's what he says on his show. Kevin Samuel says, when married women don't
He
say what
had
he
some
wants them to
different.
say, no, when married women don't say what he wants them to say, he tell them they don't have a dog in the fight, so get off and they hang up.
Oh, okay. Hurt people hurt people. So at the end of the day, like if he out here trying to hurt people and their character, somebody must have hurt him. So
Oh,
that's,
hold on.
that's my opinion about everybody.
Hold on. I'm about to put I don't know, Stranger Talk, because I'm about to put the producer on so he can share his perspective. One sec.
I'm not gonna be on that yet. My mind's
You
on
hear
it
him?
right now.
Wow.
I ain't read on that yet.
Mm. You don't want to give your
I hope everything goes well with the dog vet visit.
yes.
I ain't too sharp right now.
You don't want to give him your generalized opinion on Kevin Samuels.
What I say? He's sucker free.
He's sucker free.
That's what he say.
I'm about to put you on just a sec.
Oh, man.
Don't be scared. Scared money don't make no money. I don't know if it's a way to necessarily help. I don't know. I don't think a man with different issues can necessarily help someone to get married. Like it sounds like a lot of belittling of different cultural things, like wearing a bonnet. Like I wear a bonnet to keep my edges nice. But that doesn't mean that you won't get married because you're wearing a specific head wrap. But I am winning. He probably watching.
Hello?
Hello.
Hear me?
I don't want to be the only.
Okay.
I'm about to turn my camera off too, because
I can hear her.
You can. I'm gonna turn my camera back on.
we can hear
I'm
you.
almost done.
I can't hear her though.
No, we can hear you.
They can hear you.
Okay, they can hear me. Okay.
Okay, so go ahead. You just look at Miss Sandy's comment.
Oh, I see enough. I hear about enough foolishness. I watch a lot of TikTok
She wants your opinion. That's Miss Sandy's comment. She wants
about
My
Kevin
opinion about
Samuel.
Kevin Samuel.
Mhm.
This is real long.
Start from the top. Take your time. Take your time, Pastor.
Take your time.
So specifically, what do you think about what Kevin Samuels has to say about the propensity of women finding a high value man being low if they don't pander to the man?
Well, I don't believe in the high value system what he's talking about anyway though. It makes no sense to me. It's based on numbers and stuff like that. That's not the value of a man. That's no self-worth in that.
Okay. So do you think there are other components that give a man value?
Yeah, his character, his culture, his way he live and love and treat his woman and his family. That's a high value man to me.
True. I agree. Well,
Do we know anything about his previous relationships? And have those women weighed in on?
Unfortunately.
What'd you say?
I said we know a lot about his previous relationships, unfortunately.
So is a high value man one that has been ran through or married multiple times?
She said ran through. Oh my God. Look, you would be the right type of clinician to have on there.
Mm-hmm.
I'm
But
just wondering because if you're a high value man, then you uphold honor and family, and you stick you have your family. You stuck with your family.
yeah, but not according
Eh,
to his principles. According to his principles, a high value man is quite the opposite.
It's not no
So
dollar sign
it
attached to
only
that.
has to do with money. It has to do with how long he's had that money and status. So more like social status, more so
Exactly,
than
exactly.
economic alone. So socioeconomic status and validation from other men.
The things you say can change, and once that's gone, what you have after that. So
Right.
so then you got a what value man? What you have nothing but nothing.
Right. I mean, you might still have that woman until the last dime is hit.
Exactly. She see the last check, she gone. She checking out.
my thing is, I don't listen to anyone that doesn't align with my values or my morals
Right.
necessarily. And most of the time I watch cartoons, quite honestly. Like I barely watch the news. They have agendas. But nobody can tell me what a high value woman or a high value man is because again, it's that subjective term. What do I appreciate? What do I value? And that's the thing. Values are very different. So high value to me, like if my high value is I'm a CNA and my dude a drug dealer, well, hey, that's a high value man to me. But if my ideas of a high value man is one that is in the corporate community, then that's my idea of a high value man. So when you say I want a high value man, what does that mean? It's subjective. Doesn't mean that I want somebody like we usually pick people that align with how we grew up or how we were raised. So unfortunately, if you were involved in a if your parents were involved in a domestic relationship, you might value that not knowing that hey, I'm in this relationship because this is what I have been accustomed to. But it's high value because he still pay the bills. He just hit me a few times a week. That's why it's subjective.
Agreed.
I'm sorry, I'm looking at the phone.
I'm muting your mic. Yeah, so you muted now, so you have to shut up. I'm gonna be
He don't have to shut up. Come on.
I'm trying to be I'm trying to look, let me tell you, what's his name? The official urban therapist. What's the guy on your channel that said I muted him so that was disrespectful?
No, I'm not saying that my
Oh my god,
values
I'm
and
trying to
morals are
please
necessarily
break
childish.
the door down. Hey Jack,
I'm just saying it's just an example.
leave him alone. He can come over. Hey, sit down. What are you doing? Sit
Yeah.
down. What does he want? He wants something. Oh, he wants this sandwich. He can smell it. Well, I don't have anything left. Sorry.
Sorry, sir.
Gotta go, Jack. But I think Kamoji says being a high value man has nothing to do with morals. You don't think so?
Said child.
It has everything to do with mine and what I value.
You man, you got to get to buy them, earn them, and blow stuff to keep.
Miss Sandy says there are videos from years ago about women telling women to get a high value man. So, as a woman who I come from a time where we didn't record videos, but we definitely had radio stations and we talked about things quite frequently. And so when women spoke to um, what most people consider the hypergamous component of a high value man back then, what was really important for us is education, especially in the Black community. You wanted a man who had a certain social status, as you will. It had nothing to do with his money, but his social status back then had a lot to do with the congruence of his morals, content of his character, and spirituality. So back then, men were not couldn't rise or position themselves in a high esteemed position unless they were a part of the church. Said men are like Dr. King, Malcolm X. That's the reason that you guys hear about them so frequently when we go back and we reflect on history and civil rights movements and things like that, simply because this has always been a point of contention for the Black community. However, the lack of morals and cultural component and value systems around spirituality is what has society in this spiral now. I'm just going to say what it is. But the problem is, you guys, as parents and parents haven't done their due diligence. So I can understand the why. I just feel like you got to be a person who owns what it is. Call a thing a thing. Because you guys are too young, you didn't live in that age. I think that you got to be honest with yourself and say, well, shit, I don't know what happened, because I wasn't there for it. But as a person who lived in that age, I'm just going to speak to what the conversations entailed, and the producer, as a person who's lived in that age, we can only speak to what it is that different time looked like. And Black people didn't look like they look now. And that's something that it's sad. It's a sad truth. I think that's one of the things that Kevin Samuels definitely tries to point out. But the way that he tries to point that out is misaligned with the realities around constructing successful relationships. Because what he's trying to point out is the fact that people in today's society, modern day conceptualization of healthy relationship, is relying on financial stability that looks like XYZ. And that's not necessarily pragmatic. And that some women aren't thinking things through when they're thinking about what their expectations of when they're thinking about getting married. So they're not lining things. And one of the things that I heard him say on this one video, and I was actually going to share it tonight, but I'm so ascribed to not sharing any of his fucking content, because I'm just beyond disappointed at the fact that you really sat here and said the way that you get a woman in line is to slap a bitch. What we're not going to do, we're not going to do that. Because at the end of the day, whether the woman consents to that or not, whether it's a part of BDSM culture or not, and you're talking to a pro dame, let the state hear about that. Your ass is going to jail, period. So it don't have nothing to do with the woman prosecuting, nothing to do with her corroborating evidence and testifying against you. All they need is the pictures and the bruises. That's it. Wherever you hit her. It could be on her ass because she's not a child. It could be on her legs. She's not a child. It could be anywhere. She could easily come and testify in your defense, and that's going to be used against you in court. And I say it because I've seen people that are a part of the alternative lifestyle, because I've seen them go to jail for 5 years, 10 years for practicing domestic discipline within BDSM dynamic inside of the United States without their exceptions. So you have to understand, it looks good to talk that talk, you know what I mean? But if you don't understand the rules and how you can walk, and you don't have these contracts in place, there are several things that go along with BDSM that people that are not qualified just shouldn't talk about it. You shouldn't talk about alternative lifestyle, period, if you're not qualified. You guys barely know enough about pop culture lifestyle. But so the thing, to get back to the topic, the thing is, when you guys are in this society, the generation of people look a lot different, and the mindsets of people look a lot different. Women's point of contention then was to marry a man that was highly educated, because most of those men had gone to seminary. Seminary was considered to be, you get you a God-fearing man. That man is going to be faithful to you. He's going to be true. He's going to be a great father, great impact for your children, a great activist for your community, help grow roots and continue to spread and share your legacy. All of these things. So hypergamy back then was based on the socioeconomic constraints that didn't necessarily mean your money had to be 6 figures, because that really wasn't a thing back then. It was more around social acceptance. Social acceptance means that you've risen to a certain status in society amongst our culture, and you're recognized as a person of high esteem, high morals, high ethics, and things like that. So, yeah. But so that's something that I think that you guys just simply are completely oblivious of.
I got one more question. Given all components that he say come with a high value man, those are positions and achievements. That don't say anything about the man.
Right. Because I think that the other piece is this.
What you get for that? What are you getting out of it? You say that. What you get in return? How you know what you're getting besides just what you paid?
Exactly. So you're just
What
looking
kind
at
of
the
work you
surface
get?
things, and God, I hate to say that, but Kamoji, who raised you? You don't ask a woman's age. What's wrong with you? Let's know my oldest two kids are 30, almost 32.
Those are not.
Nanya.
Those are not characteristic traits. Those are achievements.
And they don't walk around here ascribing to some broken principles because their parents didn't give them their legacy, because they're very informed.
You know, the guy got cultivated.
Right, right. So you guys are only looking at the surface stuff, and surface thing can't really give you anything about a person. A person could be working a very high paid job, and he could have zero character.
Exactly.
Okay. Did you guys see 50 Shades of Grey? So on 50 Shades of Grey, you were able to see what it looks like for a person to be a sociopathic narcissist diagnosed. And this guy had this house built and all of his sex toys in there. He expected a certain type of behavior out of this young woman. If you read the book, you understood that this thing was a therapeutic thing for him. So it's a lot that goes along with the types of behaviors that come, that come with these new mindsets. When you allow somebody in your life just because you're trying to see how much money they make right now, how much money they made for the past 3 years, the fuck, 3 years says nothing to me. Nothing. Nothing. Because 3 years can't go into or speak to your retirement. It can't speak to your investments. It can't speak to your knowledge. It can't speak to your tenure. It can't speak to your maturation. None of these things. So for me as a woman, I would want to know, how frequent have you gone to a therapist? How frequent do you visit your medical doctor? Because these are things that historically have been concerns for the Black women in the Black community, just so you guys are aware now. So let's bring it all the way back. Let's take it back to 1969. A huge point of contention for women in our community was that men were healthy. Let's take it to 1973. It was a huge issue for women to have their men to not die on them at their girlfriend's house or wherever, and they actually end up having to bury these men at a young age, because this is something that was happening. And these men were dying in their 30s, in their 40s, in their 50s, and you just got married when you turned 20, 18. So women were becoming widows before they could really become and seat themselves in being a wife. So these were points of contention for women back then. Moving along in the 80s, women realized that men would continue to die on them, and they had no viable life insurance. So they needed to go out and be able to also provide so that there is something in their name, something that they can have to continue to take care of the family if they were made a widow. That led to the third wave of, or the second wave, actually, the ending of the second wave of the feminist movement. So advocating for equal pay in positions where they were sharing those same said positions with men was a part of them positioning themselves to be able to continue to take care of those children. Because culturally, Black culture didn't believe in remarrying. So I think that you guys need to know your history when it comes to this culture that you are very much a part of, but obviously very disconnected from. So, it just is what it is. So let's see. Kamoji said I'm lying.
I I think it has a lot to do with standards too. I'm looking at one of the comments. Um, like sometimes people make a list of things that they want in a person, but it's not always six pack, six figures, things like that. It could be compassion that that person cares for their
They don't pick a man because of just that. I mean, you don't know what you're gonna get with that. What that mean? Take me that I am because I say don't whatever.
Right.
you
And
it have to
it's
look at
unrealistic.
the morals and the values and the
You
just
know,
you look at cultural things too. So I don't care what he said. Like we have the right to listen to who we want to listen to. I'm
Exactly.
not going to listen to anybody when it comes to, well, this is what you need to look for in a relationship because I have different qualities that I want. I
And
want
high value,
your
that's
mother
the
right.
thing. Yeah,
That's
high value was about having somebody that aligned with what it is that most women wanted back then.
I could recommend to get some men close to me.
Yeah, that's what it is because he does talk about the fact that you have to be accepted by other men to be deemed a high value man.
Like a country club type thing.
Yeah, like men who are trying to make relationships with women don't care about their acceptance by other men. They just don't.
I don't get this. You have to be you're married, so you have a no dog in the fight. Like, how do you get married? You look
Right.
at standards, you look at values, you look at different things in order to choose, hey, this is someone I can build with. This person probably doesn't have six figures at this moment. I'm not necessarily looking for six figures. I'm looking for companionship. I'm looking for somebody who is good with kids. Like it's all your list. It's your this is what I want. To listen to someone talk about this is what you should look for, that's on you.
I'd rather make 5 figures for 20 years and 6 figures for 3 years.
Exactly. Exactly. But I don't think they so let me explain Kevin Samuel's rhetoric because here's the thing because you guys a lot of you think that just because I do not like Kevin Samuels, let me make something very clear to you guys. I have an accountability channel for two reasons. As an individual, I'm a pragmatist. And so as a psychiatric practitioner, psychotherapy practitioner, as an MD, I understand the pathology of people, human behavior, and also disease and infection, right? So for me, I look at the intricacies of the people and I hold people accountable as it relates to the systems that they are a part of. And it has to make sense. Pragmatism means it makes sense. So very much like the invalid stats that Kevin Samuels spews on his channel, um, I'm about the science, the reality of the science, and it has to be representative of the samples that we're talking about. So, do I have an issue with the fact of Kevin Samuels infringing upon the personal space of women and forcing his viewpoints and his opinions as fact on women? Of course. You know why? Because it makes my job harder. Because I have to, on the other end, sit with those women in hospitals where they're now suicidal, feeling less than valued, feeling helpless and hopeless, and all of that good stuff, and try to recalibrate that energy and redirect them as to how it is that they can become what it is that they aspire to be on a realistic level. Okay. So that's that part. So when he's speaking about many of the things that he talks about, he's speaking about the fact that there are incongruences in society. So there are incongruences between what women say they want, and when he's saying women, he's really referring to young women. He makes that very clear. He's not referring to women that are over 35. He's only referring to women that are in their 20s, early 20s to 30s, so he can match them up with with men who are in their 50s. He said that. Why? Because he's not looking for women who are looking for longevity out of their partner. Because he's realizing that this particular generation, all of you guys, we all realize it. So it's not something we don't realize. The issue is that it's not that we don't realize that all these Gen Zers and what are they? Gen Zers and Gen X or whatever. It's not that we don't realize these things, okay, about you. This is the reality. We want more from you than you are currently able to ascribe to and create for yourself by the vast majority. So there are selective ones of you who will have very meaningful relationships and you guys will get married just like Dominique here. And there are some of you that will definitely be, just like Kevin Samuel says, dying old with a dog. And
I
it's
don't, I
just you.
don't want a dog in this fight. Please, just like, I don't care about anybody that's trying to tell somebody, hey, you need to do this to get a relationship. You need to do that to get a relationship.
Right. And
Like,
it's all surface stuff. And that's the crazy thing. When you're talking about these kind of, and the fact is, he promotes sex workers and their ability to, to get a high value man. He tells them that they can, but the regular woman is like, no, you're not going to be able to get a high value man. You need an average man and you're going to have to work too. And I don't have a problem with that. Whatever realities he helps them accomplish over the course of their becoming, whatever realities he wants to force on them, I'm fine, because at the end of the day, you're going there for a reason. So accountability says I need to hold the women that are going there accountable. Because for me, the women who are calling him for advice, I got to ask the question, why would you go to him for advice?
Well, you know his high value woman thing, the same thing.
Right. He says that a woman's value is in her sexual marketplace value. That's, yeah, that he's only talking about young women, because older women are not women who have, excuse me, ladies, but thought it themselves around. And this is something that your current generation ascribes to. You can't make this stuff up. You can't make this stuff up. At the end of the day, I think that women sometimes have very unrealistic expectations out of relationships based on their behaviors. He's pointed that out and he's capitalized off of that. Men are the same, but that's the reason why they keep finding themselves in relationships where they're breaking each other down. But what I won't do is sit back and be silent as he promotes domestic violence against young people and shape you in your behaviors in a way that's not conducive, to your freedom. I mean, unless you like jail. I don't know. I hear black men complain about the disparate numbers of black people in jail all the time, but you guys keep going back. So I don't know if it's that you really like jail or you just like crime and don't want jail, but end up. I don't know. I can only say what I see. Okay. So here is the thing. If you have the mindset that leads you to a person like Kevin Samuels for advice as to who you're becoming as a woman, if you have the mindset of a person like Courtney, even, because Courtney is a person that has been on his show, who respects everything that he says and describes almost pretty much everything he says, right? I can't even say pretty much. She's more like a lap dog. I showed you guys that clip yesterday. Clearly, there is some level of emotional hostility and reactivity when she sees the truths come out from other cultures of women. We saw that, right? So obviously she knows that Kevin Samuels isn't right in everything that he preaches. I heard Kevin Samuels tell a woman from Hispanic culture that she wasn't true Hispanic. She's like, well, my parents were born in Mexico, and I mean, I was born in America, but I spent the vast majority of my upbringing in Mexico with my family in Mexico. We go back home. We're there more often than we are here. So I don't know. Maybe I'm not Mexican. You know what I mean? But he specifically told this young lady, well, you're not culturally Mexican. I don't know. Maybe that's just my first language. You're right. Whatever. So the reality is this: he hasn't studied anybody's culture. He doesn't have any degrees. He doesn't have any education. He doesn't have any credentials to speak on the things that he speaks on. If this is a person that you want to go to for your balance, for your health, for your wellness, continue. That's what I will say. I cannot prevent you guys from going there, but I cannot also decide that, okay, I'm going to subscribe to these notions that I know are volatile and unrealistic either. The reality is
accountability.
exactly.
Like we've been talking about, like you have a duty to people that you could be treating or people that you are
Right.
treating to, hey, this could be a detriment. So
Exactly. To a person's sense of self. So just because Kevin has an inflated sense of self and you guys have contributed to that doesn't mean I'm going to contribute to that. You know what I'm saying? You guys can pedestalize him. You can call him the grandfather, the godfather, the God Almighty, whatever you is, because you know what? I believe everybody needs a higher power to believe in, to guide and shape the way that they are responsible for the things that they do while they're on this world. Exactly. So whatever it is that you want to ascribe to, I'm 100% for you guys. However, Kevin Samuels is not God here, not on this channel.
I saw a comment, something about they go to him because everything else hasn't worked. I would invite them to
Go to therapy.
has therapy work. You know, like if you feel like something is broken inside of you, then you need to kind of figure those things out, figure out what things are contributing to these issues and work on it in that way. And I mean, you can listen to whoever you want to, but as a clinician, I would just say you need to figure out or sort out what's going on within you, not necessarily what somebody else is saying. Work on your heart first.
Oh yeah, I did see this one woman that was 40 or was she 39 or was she? Oh, she was 39. That was funny. I mean,
That's another thing. If you're choosing
yes.
someone who is violent, for example, that goes back to the trauma. Maybe you were raised in a traumatic household and it was very hard for you to not pick somebody that was violent, for example. I mean, it all goes back to trauma, your childhood, things like that. So if you're not picking a person that is treating you right, then you got to look at self.
Well, I'm trying to go through you guys' comments. Y'all make a lot of comments, so whatever y'all
It
say.
is. And I agree with Kimoji. Like, I don't care about this guy. I mean, I don't know how we got on this topic.
Mr. Brooks, you're
Um,
right. I think Miss Sandy asked
oh yeah,
how you
asked
felt.
about how I felt about Kevin Samuels.
That don't
But
mean
I
you're gonna pay everything. That don't mean that. That don't mean that. Not to me.
Who's a pick me?
yeah,
What is a pick me?
like, hey, here, pick me. Like, literally.
Oh, like on the ball field.
Yeah,
Mm,
like a put me in the game coach
yeah.
type of thing. Like something like that. But um
Look, Kevin Samuels. Look, I know, right? 71% of women in Mexico between ages 30 and 59 get married. How do you expect to account for people in Mexico? I can't have this conversation with you.
you
How
know,
have
I
you ever been to Mexico? Do you know how they keep up with their stats of in their citizenship?
What they do?
They don't.
what
They
they
don't. Only the wealthy people keep up with stats and citizenship. You can't go to the hospital even to have a baby if you don't have insurance, if your family doesn't have money. So they have no way to keep up with who's being born and who isn't. So if you're there, you are a Mexican citizen, but you may not have documentation from a hospital. So there's no way to keep track of anything in Mexico. Just stop. Just stop.
That rough.
Yeah, Laurita, Lana, the same women I had you meet at the table. My
I
best
think
friends are Mexicans.
the 1 in 4 black women get married something wrong. I think that is something that is a different topic. I don't think it's something that Kevin Samuels is going to fix with his
Exactly.
speaking and things that he does. I think it is a systematic and a cultural type of thing that has happened that has destroyed the black family.
It
But
is.
that's another topic. It's not anything that Kevin Samuels is going to, well, this is the reason why. No, it has everything to do with how the black family had been destroyed over generations. But again,
The official urban therapist said it's definitely something wrong when you direct quote Kevin verbatim.
Kevin is live. I might watch him for the first time, you know, instead
Let
of my
me
cartoons tonight.
Let me play this quick flick. 'Cause
Don't.
this
I
one,
was just joking. Please.
look, this one isn't all that bad. This is the one I was telling you about earlier, actually. I'm just not gonna play any of his like negative content or whatever on here, but this one I think you gotta see. So let's just watch this one. Kamoji, are you being triggered by all this Kevin Samuel stuff? Like,
Yeah, if he's live, you should probably,
you should probably go over there and watch him.
Oh,
Yeah,
he's
if
saying he's a lame. Who, Kevin?
yeah, go watch Kevin if he's live. Like, yeah, go over there and do that. I think that'll be good for you.
Look,
You
I
know
got
what
a
I'm
5
saying?
a.m. workout.
What'd you say? Hold, wait, I'm about to pull it up. It's
I got a 5 a.m. workout. That's what I said.
oh, let me see. I gotta pull up this thing. I gotta put it in a separate browser. Please understand that viewers' discretion is advised at this point. Because I know that some people are definitely triggered by content from Kevin Samuels. He can sometimes be a bit much, but I definitely found this to be entertainment. So for
Oh,
entertainment purposes,
emoji is live.
oh wait.
I feel like it's not honestly both ways.
Oh, now this is a high value man.
It goes what?
Both ways.
Okay, we only want to talk about the way it goes with the women.
Okay.
Look at it. First of all, you just gonna tell her what you're gonna talk about.
No respect
Right.
for that person. That's not a value man
Let
to
me
me.
rewind a
You
second.
have
How
to
old? What's
respect.
your first name? How old are you?
My name is Zoella and I'm 25.
All right, what do you got for me? We're talking about being capped tonight.
Okay. So Lee.
Hold on. Hold on. I'm gonna say this now. I was taken aback by her going into this as well, because I just learned that cap is also something for you younger people, and it means something different than what we see as a standard or whatever. The most that you can get.
Oh, yeah,
So,
cap, like you capping. You
yeah, that's what she was saying. But I was like, what is she talking about? So I'm gonna say that it just depends. I think it gives context to our age, because you can't possibly. I'm like, what?
cap.
You
Like
remember
Kevin.
Constance said that capping means you're telling a lie or something like that.
Yeah, like it's not factual, not
Yeah.
rooted in facts. Look it up in the dictionary, the Urban Dictionary.
Look, that's why I have all these kids, they can explain it to my therapy kids are probably the best at giving me all the so let me hit play.
A lot of people come on your show and they really try to tell you that you're wrong. No, I don't necessarily think you're wrong. I think that
Even somebody agreeing with him. She's
like,
a therapist.
I think that just as far as being capped, I feel like it's not honestly both ways. Like
what? Wait a minute. It goes what?
Both ways.
Okay, we only want to talk about the way it goes with the women.
Okay, well, fine. All right.
Because we have 50 years of talking about the way it goes with the men. I won't hear nothing about that.
Okay, fair enough. So I feel like with us, a lot of the times, like maybe we cap about like what we want. Like you know how you ask all the women what they want, and then you hit them with the 3 little questions, and they
Well,
say,
that's not the cap. That's not. I don't mean like you're capping. I'm saying you're capped, meaning you have an upper limit of what you can get.
"Okay, yes, I agree." So take me for instance. So I'm 25 years old, but I'm in a career that I'm the youngest person in my career. So I'm a therapist, and a lot of the people in my career are older than me, right?
Okay.
And so a lot of the men that I attract are older than me. Because you talked about how the young men don't have respect for older men, so there's a learning gap. And then there's older men who are attracted to me because I'm 25 with no children, with a career, living on my own. But because I didn't grow up with a man in the house necessarily.
What do you think you're okay? Your cap would be what? Regarding relationships.
I would say my cap would have to be the
Your
oldest.
sexual marketplace value.
I would say
that is your cap.
like the cap. I would probably do 39.
No. the kind of man you can get, the cap, the top, the limit.
I think
Listen.
I'm listening to you. Don't do me like that. I'm listening. I'm just a little.
Don't tell me what to do.
No, I'm just asking.
I'm just let me do what I do. I've let you talk, and the reason I stepped in is because you're not on subject. You're just talking. The cap meaning, what is the top kind of man you can qualify for? And what is the bottom man you qualify for? And what's the average? That's the cap.
Or like what I think.
Well, it's not about what you think. Everybody has a cap, and a woman's cap is her sexual marketplace value. This is why you can be a woman with a high school diploma and marry a millionaire if you have a high enough SMV. And you can be a woman with a PhD and can't get a husband.
Yeah.
Because you're unattractive.
That's real.
That's an SMV. So what would your cap be?
I think 47.
Who's that? Who just came in that car?
My bill.
Hey.
Say hi.
How you doing? I don't think you're understanding the topic, so it's not about an age. It's about what kind of man. So you said you're a professional, you're a therapist.
Mm-hmm.
Do you have a bachelor's, master's, what?
A bachelor's, and I'm going for my master's right now.
And how much do you anticipate making midway through your career? By the time you're 45 years old, about how much do you think you'll be making annually?
So right now, I make about 79, almost 80.
So midway through your career, about 45, what do you think you'll be making?
Probably over $1 million.
Annually?
Yeah, because what I'm trying to do with mental health in our community, I think people are going to accept it more than they do.
How to get the best tool for creating stunning videos?
And I'm figuring everything that I'm trying to do on the side.
How many people or therapists make $1 million annually?
Well, aside from what I make right now, just at a job, plus what I'm going to be doing, I'm not going to work my job forever. So if I make almost
you can't even have the conversation. I just asked you, every question I've asked you, you just talked. I said, midway through your career, what do you think you're going to make annually? You're honestly saying, I expect to be a millionaire as a therapist.
I'm serious.
Okay, good. Which fairy tales do come true, but that's not real. That's not ma'am. I talk to therapists. I network with therapists. I work with psychiatrists, psychologists, PhDs from Ivy League, and they ain't making that kind of money.
And I ask you a question.
I need you to listen. I need you to listen. Okay, there she goes. You're not going over. You're already on cue.
Oh wait, I'm not trying to be rude.
What I need you to understand is you can't even. I don't want to talk about what you want to talk about. I'm talking about what I'm talking about, my subject, and I can't even get you to understand what you plan on making about halfway through. But let's just say you're making $1 million. Let's just go ahead and say it. You're making $1 million. Then how much do you want to get married one day? Mm-hmm. You want children?
Yes, I do.
How many children would you like to have?
3 to 4.
3 to 4. And do you want to have to work to pay significant bills after you're pregnant with your first child after marriage?
I probably will have to.
Do you want to have to work to pay significant bills after you're pregnant with your first child when you're married?
Yes.
Okay. What percentage of the family financial load do you want to have to be responsible for a lifetime with 4 children, you and a husband? What percentage overall for a lifetime?
20 to 30.
20 to 30%. So you still are looking for a provider male, a man making enough to pay 70 to 80% of the bills, meaning if you stop working for any reason, the family would not be significantly impacted. How much money would a man need to make to provide for a family of 4 children, a wife, and himself to not have her income impact the family in any long-term way? How much money would he need to make annually?
Probably 80 to 100,000.
What state do you live in?
Texas.
$80,000 for 6 people.
Sign now offers all the native integrations you need. Choose the best.
I grew up in the country, so it doesn't really.
See what I mean? They don't know their caps, folks. See, this is a woman that says she thinks her plan is to make $1 million, but I got down to the real numbers of it. She thinks a man with $80,000 will be able to provide a middle-class lifestyle.
Why wouldn't he though? You said middle class.
Math. Because the average black man in this country makes $41,500.
With a
The
high
average.
school.
I need you to. Okay, obviously you don't know.
Wait, why?
So I need you to because as a therapist, as an educated woman, and you want these things, y'all should know this stuff.
But
You
I
should know. You should know that it's impossible to have a man making $80,000 and then you not have to work. 4 children, you guys would be lit, ma'am. The average child takes about $250,000 from age 0 to 18. 3 children. And for you not to have to work to pay significant bills in Texas, you're talking about a man making about $300,000 to $350,000 a year. 4 children at another $100,000. You're talking about a man making close to $400,000, almost $500,000. Not 80. $80,000 will not pay for 4 children. It's college fund, retirement, 401k, medical insurance.
Talking about to raise a child or for them to go past? Because
I'm going to have a conversation with the audience. Okay, see, this is why women don't understand their caps. They don't understand their caps because they don't even understand how much money a man needs to make. They don't even understand what they're asking about. So it's all fantasy. It's all fantasy. It's all fantasy. It's all fantasy for women at this point. Because I can't have the conversation with you, man, because I'm talking at a different level of understanding. I'm talking about calculus. You're talking about arithmetic.
I'm not. I'm just asking you to.
Okay. I'm going to go ahead and have the presentation. All right. See, I couldn't even get to where I need to get to with her. And at the end of the day, like it or not, I can still do this. That woman still wants a man to pay 70 to 80% of the bills. That's still a provider male. That means if you have a 4-leg table, 1, 2, 3, a table can stand with 3 legs. Black women in particular, don't want their money to impact the family in any kind of way.
All right. So let's have that conversation about the man making $80,000. Now, I'm just gonna say what it is, and you guys are crazy in the comments. I don't know what y'all doing over there, okay?
It's hilarious.
But let's use Kevin Samuel's math, okay? If this young lady was looking to allow her provider male to be the person that's bringing in $80,000 for her family of 4, and this is just if they were to go ahead and have 4 kids off the bat. So they're going to have quintuplets off the bat, okay? And for 18 years, you're taking his 80 grand. Now, she did say that she felt like she wanted to work 20 to 30% would be what she's responsible for, is what she says. Her man could still be the provider male. So when he equates to $250,000, it does take around about to provide an above average, by the way, just going to say, lifestyle for 4 kids over the 18 years. So let's do the math. If we're talking about per child, it's around what, 1,300 or so each. Okay. So we did 4 of them. We're like 5,500 each per year, taken away from his flexible income. Okay. Now, if we went to how much of his income would be left now, they would still have a good $24,000, almost $25,000 left to play with, to pay bills with, and to do all of that stuff. Now that's not counting her 20 to 30%. I'm just gonna do this is just basic math, people, okay? So let's say they lived in a house. She said she wanted to live in the country. Let's say they were purchasing their house and their mortgage was $750. Okay. After the $750, he still has plenty of money to move around. Because by the way, that first initial amount was also to provide food for all of them. That's for all of them. Okay. He still has a significant amount of money during those years to provide for them. And he is living tax free at this point because he's still under $100,000 annually. So if he's claiming all of them on his taxes, even just two, he is at zero tax liability. Well, I don't know. She said in the country. I don't know what that meant. I mean, I live in Atlanta, and a couple of the houses that I purchased that were at $200,000, and those were pretty nice size homes, you know, 3,200, 3,600 square feet. You know, my mortgage was pretty low, 0.5%. But, you know, it just depends on your credit. I hope that her credit's good. I mean, she could be making, so I think that she's referring to, and my question for you guys, thinking and trying to go along the lines with Kevin Samuels, being a therapist and being a therapist who is an independent practice is a completely different ball game. Okay. So it's very possible to make $1 million is nothing for a mental health practice. I just spoke to you guys about the numbers. A Medicaid fraud. Like, but anyway. Anyway. Let's push past, okay? If she's providing 20 to 30% of the bills in the household and all that good stuff, that's all the bills in the household and then some date night money, okay? That's also insurance for life insurance, medical insurance, all of that. She got plenty of money to play with. That's even if she was only making $20,000 or $30,000 annually. She'd be able to do that. She'd be able to invest in a cash policy and a separate life insurance policy for the kids and a cash accruance policy. You can cash that out as cash when the kid turns 18 and that becomes their trust fund, which is typically the best way to do it because it only costs you a couple of cents a month. But so, you know, I'm not telling you guys how to parent out here. I'm not telling you guys how to spend your money out here. But what I will say is this. Listening to someone talk about having money and what it looks like to provide for a family, and he hasn't done that historically himself. His child support order is out there. His child support calculation based on the data labor statistics said that the man attestation to him making $800 a month was a truth. They found that to be true. That's how much money that he was making a month. So this is while he was married, in his relationship with his wife. And so these are things, these are facts. So he doesn't have the experience to speak on what it takes to raise a family because he didn't raise a family. The child is now grown, yes, but his child support order was back in 2012. Like, it's out there. She was a child then. I've interviewed her too, by the way. So here's the thing. He has not provided for, he didn't even pay the child support he was ordered. So, shit, what was it, $80? The fuck? $80 a month?
Yikes.
So let me, look, y'all just listen. I can't take y'all serious because I said I wouldn't do this. I'm not gonna talk about this man's personal life as it relates to his wife and his child and his failures in that aspect because I said that I wouldn't do that because I hate to tear down the personal character of a person. Let's just talk about the validity of the argument. The validity of the argument is trash. Why? Because obviously I'm a mom. I've been doing this for a long time. And guess what? As a mom that's been doing it for a very long time, and you guys have assistants in America. Okay, my kids were raised abroad in America and outside of America. Over 30 years of parenting. It doesn't cost that much. It doesn't. So says he was broke back then. We were all broke at one point. Not sure why everyone is shitting on where we came from. No. I think you got to speak for yourself on that one. I've never been broke. I came from money. So that's what I'm telling you. So when you have a broke man's mentality, which I agree, this is what you think is goals and this is what you think is money. And you think that it's so out of reach and so out of touch because this isn't the life that you've lived. The only success that this man has had is from YouTube income. This is the first time that he's made 6 figures in his life. So, yeah. So you guys got to understand that he blew up only 3 years ago. He's been doing this for 3 years. That's it. The fuck? Yeah. You know what I mean? He's out there thinking that success is equated with buying new watches and new cars. He thinks like
very much Candace Owens vibes.
Well, I don't care about all that. Candace Owens is an honest person. So she told y'all that George Floyd wasn't a martyr, and the truth is he didn't die for a cause.
The gaslighting, like that. The right. This video was disgusting because of how he treated that woman.
Exactly.
And made her feel like she was just delusional. And that's not a way for a man to treat a woman. And that's
in general.
That is why he's not a high value man.
And you can't have an intelligible interview, intelligible conversation with a person, and you want to hang up on a person mid-conversation, which is a direct disrespectful thing you do.
No, you can't treat anybody like that. I could tell from the demeanors when the video first started that it was just going to be a little like off. Like that was like legit gaslighting.
Exactly. That's what I'm saying. But they don't understand what that looks like because they're not clinical. So what I say is this. He has a problem with even the people who agree with him because he wants to direct and he wants to be in charge of the conversation because he's a man that's not been in charge of anything. And I get it. That's his pain. That's his insecurity. But hurt people. If you know that you need the help, get the help that you need. Move forward, do great things. He could definitely have a positive impact because he's not all that cute of a guy, but he's definitely got an attractive dress style now at this phase of his life most of the time. He told his truth. Let's put it like that, you guys. Mr. Brooks, I do teach this to young Black women and Black men. I facilitate parent classes. That's what I do. I have one currently in session. We're on the last 3 modules and I'm pushing. So they're typically 12 weeks in duration. Each week is a different module. It's very intensive, but it's extremely informational. We cover everything that you can think of, parenting from the burdens financially and minimal budgeting. And it's just so much. It's so much. Trust funds, success in financial wealth versus just attaining financial security or money. I mean, we cover a lot of things. Parenting practices, disciplinary practices, you name it, we do it. So here's the thing. What I will say is this. If you do not work on a certain field, you cannot talk to what the potential of that person earning in that certain field is because you don't have their said education. For him to think that a woman needs a PhD to be a therapist and this woman is a bachelor's level supervised therapist. And I want to clear that up. So there's a difference in what we do and a bachelor's level intern who is pursuing their master's degree. Um, it's they're not synonymous. And she's right. She could definitely be making upwards toward. She can make $100,000 easy. As just a bachelor's level intern. So that tells you after she acquires the additional information that is going to seek her in higher positions in mental health, obviously upwards toward $1 million, more than $1 million. So it's not that this field is not a dying one. It's not one. I'm sorry. Um, so I have to help you guys out with this one contention, okay? People who make the kind of money that you aspire to make, we don't evaluate that money the way you do, because the stats that you're looking at is going to be based off of income earned and not business income. So personal income, if any person that runs a business, they should know their personal income should not equate to what their business profits, okay? And they should, these are things that are go over your head though, because the thing is when you don't come from money, you don't know how to handle money, which is why people get a lot of money real quick and it's gone. Why do you think these people who are rappers in the music industry, entertainment industry, period? Yeah, lottery. Why do you think these people go broke so quick? It's because you have a broke man's mentality. You have to do the work on yourself to figure out why you're there. After you figure out why you're there, then you now need to deconstruct some of those thought processes that keep you in these negative spending patterns. But so
I'm ignorant to this. How long has he been talking about a high value person, woman, man?
2 years.
2 years.
Yeah,
How many videos?
He got a lot of videos out there.
Okay.
Millions.
So we talked about insanity before, like how people say doing the same thing, expecting different results. If someone has been listening to this man for 2 years and is expecting a high value man and still hasn't had one after this amount of time, maybe therapy is a good option.
I'm telling you.
I mean, that's
Competent. Seeing a competent therapist.
Competent, absolutely. Because it's like all these videos and you're nowhere in the relationship goal that you have set for yourself.
And you're still
it's enough for me. Is this how many minutes did we listen to this?
9. Well, we didn't listen to the whole 9, maybe 8 minutes.
That's enough. Because I mean it's a dead end. It sounds like a dead end.
He suggests therapy, but he's not in therapy. So to be a true believer, I need to see you embrace it.
I'm disgusted. I got to go to bed. I got a 5 o'clock appointment.
Man, you can't make this stuff up. But here's the thing, you guys. I think that, like I said before, if you guys want to follow Kevin Samuels, by all means, go ahead, subscribe to the ideas that he preaches and do exactly what it is you feel you need to do for you to keep yourself balanced or whatever. I still, thank you guys for your commentary, for coming in, for sharing your thoughts and your feelings and things like that. Accountability, right? If you find yourself staying in the same different seated behaviors that are not attaining your end goal that you initially decided that you were trying to attain by moving in this way, right? Ask yourself, what do I need to do differently so that I can ascribe to a different methodology or a different mentality as opposed to the one that I've been maintaining so that I can get some type of different results? Because obviously what you've been doing ain't working. So I think you have to definitely be honest with yourself, be very transparent with yourself, but also be permissive with yourself. So be permissive in the way that allows you to subscribe to something different, not more of the same. Take a break from Kevin Samuels and see how you feel after 2 weeks. So, Dominique, in closing, go ahead and let them know where they can find you.
You can find me Facebook, Instagram, Twitter at IPCS Indiana, or you can find me on Facebook at that LCSW Dominique. Also, my email is djp at inspiredpeace.org. I'm sorry.
Inspired with a D.
What'd you say?
Inspired with a D.
Inspired, yeah, it's my Indiana accent. And on Anchor at All Things Mental. But I have enjoyed this, all the things that I didn't agree with, all the things I did agree with, because that's what human beings do. They give you the opportunity to express yourself, and they move on. So I'll be moving on. Thank you all, and thanks, Dr. J.
All right, so you guys, that's all I have. Good God.
I know, right?
Yeah, all right. Okay. That's all I got, you guys. On that note, Miss Sandy, if I've ever been speechless, that's all I got, you guys. See you later. Make good choices, be free, live free, and do not infringe on anybody else's peace and happiness, folks. Go out there and be great, make a positive impact in this world that we know and live and trust in. That's all I've got, you guys. Later days. Bye.
Who alive can't put me in a box. I redefine any definition you got. I am the tiger, I'm making steps to the top. The flames, I rip it up, you just gotta hand me the rock. Take a seat, you cannot stand it. All I know, the flow harder than a Scotch bunny. Don't try studying me, you cannot manage. This ain't what you want, bitch, I'm a fucking phenomenon. This ain't what you want, bitch, I'm a fucking phenomenon.